Sorry. Ew. I feel like I got something in my teeth. Hey, Cherry. I got the med list. The the prosecution's med list. I want to go over it. It's quite startling. And the timeline to the med list. So we can put those to rest. So I let you up. Okay. Okay. Well, wait. I'm going to wait until you come up to go over it. But I'll just like let people start coming in because I want to go over the timeline of the med list. I got the prosecution's timeline and med list. So I think it's super important. And I got knocked off earlier. Hello, everybody. How are y'all?
Hey,
You can
I'll
wait.
be here.
You can
I'm
wait.
just gonna, no, I'll be here. I'll just be on mute for a minute, but I'm here.
Okay, you're good. It'll take a while for everybody to get in, but I got knocked off earlier and we had a couple hundred people in here, a few hundred people, and I've got the prosecution's timeline and med list. So
Yeah.
very excited to go over it. Do I have food on my
Yeah.
face?
No, I don't
Sorry,
see
y'all.
any.
This is barbecue. But I want to go over it for sure. How's your Sunday going?
That's going good. It was a kind of a lazy day. Made tacos for dinner. And,
I made ribs,
ooh, that sounds good.
salad. It was good. I know I feel like I've got rib meat all in my teeth and everything. So if y'all see anything in my tooth, tell me. But yeah, I got knocked off earlier because I had a patient phone call and it disconnected the live. But that's good because it gave me time to pull up the prosecution's med list, which I find very, very interesting. And I think it's going to give us some insight of why he's doing what he's doing, Reddington. So thank you, Amy. Hello, hello, hello. And I'm going to re-go over the timeline. I'm waiting to see if Chad can bring the new dry erase board in, but the timeline, I've got a better breakdown of that 47 minutes.
I've been like, when I have scrolled through TikTok today, like I'm seeing like different lives and, different people's opinions and stuff. And I just, I listen, but man, some of these people, like, one person just said, I think it's like the fifth day of the trial. I'm like, but yet you're covering this trial and you don't realize tomorrow is the 10th day.
Right.
That's scary.
No. You know what the scariest part for me on this is that these people could possibly be jurors one day and they are so not open to listening to anything other than what they went in with. That
Right.
it's scary to think that these kind of people could be sitting on a jury.
Yeah. Because you have to be able to look at it from every angle. And so
Right.
like if I'm on a jury and I'm responsible for somebody's life here, like I don't take that lightly and I don't think anybody else should. Like you should be open to hearing
Right.
both sides. And a lot of people on TikTok, they're not. They're either against her or for her or they have complete misinformation. Like you think we're on the fifth day? Yikes.
Right. But you're covering
Yikes.
it.
And you're holding panels every day, dear. You really need to
I know.
get
I've
with the
listened to some
program.
other creators too, and they like won't even let people like give their opinions. They just block, 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 and like this is it. And they're wrong. They're not even quoting facts from the
Right.
trial. You know what I mean? And that's how misinformation gets out. You know what I mean? That's why this morning I'm like, I'm not going to give you my opinion. I'm only going to talk about the things I can see from the prosecution, not the defense.
Well, and
And
like
share that with
someone
you.
was in a live just now and they were like, they mentioned you and they were like, well, of course she can crush meds because it gets into your system faster, Jen. And I'm sitting there and I'm like, okay, hold the hell up.
Right.
First off, if it's a time release capsule, it's not gonna get any faster or slower.
You have to be able to
And
really crush it down to powder.
and second, like if you want something faster, don't put it in a drink. You fucking snort that shit. Like what?
So let's just
What?
go old school and do this right. I have
Yeah,
to-
like you know what I'm saying? Like if you're gonna do it, fucking do it.
right.
Like putting it in a drink, you're not even gonna get the whole thing.
And he was doing that before that day. He even said that, he was
Exactly.
doing it. So we're not even talking about the day in question. For those of you who just came in, I've got the medication list that the prosecution put out and the timeline dates that it was given to her. So we're going to look at what a small window these medications were prescribed, some within only like 2 days apart, and how many she was able to take at a time. So, and I'm sorry for you, those of you, I got knocked off earlier. I had a patient called and I lost the live. So I just waited a while to come up and that way Cherry could come too. But I think it's going to be very interesting when we go over this medication list and the timeline that it was given. It's going to blow your mind. It really is. It's shocking that this doctor doesn't lose her license over this. I'm really just Jennifer Tufts. Hey, Miss Henny.
Oh,
Hi,
God,
Amy.
yeah.
Hello, everybody.
I couldn't stand watching her on the stand.
I know I don't like her. If y'all could, y'all know I don't normally ask, but can you guys tap the screen and share the live so we can get everybody back in that was here this morning? Because I think that this medication timeline and list is really important that we share it and just put that to rest. So if y'all could tap and share the live, I would appreciate it so we can get everybody back in. Thank you. Thank you. Thank you. So, and again, every bit of information that we share is the prosecution's information. We're not even going with the defense. We're not going with anything other than what's in black and white from the prosecution. So
I'm honestly super excited. I think that we should, like before we end this live, come up with a day, like maybe midweek next week, for you and I to go live to talk about like where we're at with the defense, because I'm really, really excited about this.
why don't we do a big one like Wednesday, cut the week in half and go over the Monday, Tuesday, Wednesday. I think I'm off Wednesday too. And then we can do it like a big one Saturday, go over the other days. Y'all for sharing.
Sorry, my dog. Yeah, absolutely. Oh, let's do that because I'm really like excited about the
I am
defense.
too. I was rewatching clips of Reddington, and look, if he was trying to get her off on insanity, he had no reason to show the watch. He had no reason to show the medications like he's done. He's setting us up. He's about to pull a Hail Mary and drop a bomb this week, and I'm here for it.
Well, and why does he need a criminal defense attorney now? Since the whole email thing came out, and you know, someone was on a different panel like a little bit ago and was like, "Well, that's just a rumor," and I'm like, "It's not a rumor." I actually looked it up yesterday when someone said that in our chat, and it is true. He has a criminal
Angel, you're a
defense
psych
attorney
nurse? Oh, I'm sorry.
that
Go ahead,
he
Claire.
put on retainer. So that's
Yeah,
really weird to me.
That's interesting. That's very interesting. Angel, glad to have you here. I'd love your opinion when we go over the med list because it's mind-boggling to me. And whether you agree with me or disagree, I'd love to have you up and hear your opinion. This is an open panel. We're here for discussion. So, yeah, I really love when we get our medical professionals in.
So then maybe like after we end this live, we can both put up a post that will be live like Wednesday evening. 6 o'clock would probably be better for me. It depends on when you're available.
That's fine with me, whatever works with you.
Okay, because by 6 I'll have like the kids would be fed and getting ready to lay down. So that'd probably be best for me.
Yeah, that's perfect. And you're able so much more to watch during the week with the way you work from home than if I'm out with patients. I have a hard time keeping up, so it gives me a chance to go over things with you in the evening and during the day too. Yes, I have the med list, and we didn't talk about that earlier. We did, but I didn't have the verified dates and times. But we got the prosecution's time and med list, everything. Again, everything's from the prosecution, so y'all can't say that it's my opinion or it's the defense. It's all theirs. So I'm excited to go over it, and I'm so glad we have a psych nurse in here. What part of USA are you? The difference here in the UK? I'm in Florida, Miss Henny, so I think I'm 6 hours behind you. It's probably about midnight there. Welcome in from the UK. You're in Virginia? Wonderful. I'm watching Court TV all day at work listening. So is Jerry.
Me too. I work from home, so it's really easy for me. So yeah, I've been watching it every single day.
He's the one with the details. So I have to catch up through her and all this stuff. Hi from Ireland. Hello. My grandparents are born in Connemara. So hello, Wendy. Yeah, if y'all could share the live and just tap, and you normally don't ask for y'all to do that, but I would like to get all of our people back in because the meds were a big topic of discussion this morning, but I didn't have the exact dates, and so I didn't really want to go into them and lie. So we were able to pull the prosecution's med list and timeline. So let's talk about it. I'm excited. Yeah, I love Connemara. Do you? Yeah, my dad was born there, and my grandparents, and they moved here when he was a teenager. So I've never been, but I can't wait to go. I think he's going to destroy somewhere. I don't think he will, but I think he is too. I am in love with this Mr. Reddington. This 75-year-old man. I'm like,
Me too. I feel like he's like like I know we always say like a woman's woman, but I feel like he's a man's woman. You know what I
Yeah.
mean? Like he is just
yeah.
like the way that he stood up and was like, "This is not the Handmaid's Tale. We are not going to put tape over her mouth." Like I was like, "Yes."
I know. I love him. I just love it. There's something about him that I just am like.
And I feel like he truly like cares about Lindsay, and like he really truly like is doing this case not because it's just another person he wants to get off, but like I feel like he really truly believes in this,
I
and
do too.
I love that. I love it.
His kids are attorneys too. For those of y'all coming in, we're going to do the prosecution's med list. I have the timeline, so we're just going to give some people a chance to come in and go over that. And I'm sorry to keep repeating myself, but I don't want people to leave just thinking we're just sitting here. Trazodone is scary. It messed me up emotionally. I couldn't tolerate it. Hippie Nana, it's very strong. Like I said earlier, that's what us in the medical field, we refer to them as psych ward sleepers, and our psych nurse is here and she can probably verify that, you give them that and you can do your rounds without waking up, and it's not like one flew over the cuckoo's nest in there, it keeps everybody asleep. So, they're very strong. Trazodone made me sleepwalk. Yeah, I believe it. He's one of the best MMA first one off at it. Really? That's awesome. Yeah, I mean, he's great. Definitely a heavy hitter. Yeah, Angel. I mean, they've got bigger ones now, but I know that's pretty common that we use in nursing homes, psych wards, things like that. Did they, honey? Oh, I'm so sorry. They're strong. They're strong medications, especially with everybody else.
I didn't, even with me being in the health field and I've been on Trazodone before, I never felt like it was that strong, but I mean, I guess it could be for.
It doesn't
I guess
F
it
you
depends
up.
on
It
the
just
milligram.
knocks you out.
I guess it depends on the milligram too. I don't know.
Yeah. Let me see the milligram.
She was on
I'm so
Ambien
excited.
as well, though, right?
Huh?
She was on Ambien as well, though, right?
Yes. Yeah. I've got the med list from mid-October all the way to January 16th. So we're talking to November, December. So we're talking about a 90-day difference here. Right, Angel? Yeah, everybody is different. Hey, Jenny.
Yeah.
But I just want to go over, and that I think it's 74 days total of the medications that they had put her on. That's the thing with psych meds, right? Everybody is different in how their body reacts. But I think we'll agree, Angel, both of us being in the medical field and understanding medications, that the list that we're about to put out,
It's insane.
It's insane. Yeah, it was irresponsible at that. Very
Super irresponsible. Yes.
Yeah. So I'm going to give it like 2 more minutes.
I feel like Adam and I should be friends by now. He's been in here every day yelling at us.
Who? Adam?
Adam and Flower Power. They love to yell at us.
I know. Oh yeah, Ambien. I love Ambien. It's how I slept for the last 20 years. So
I just got off of Ambien, and that's really hard to get off of because I've been on it for 10 years.
Yeah, it is. It is hard once you get used to using it. Angel, this is 72 days worth of her. So I'll give you these the list if you'd like it. So, well, we love having you, Adam, and we're just busting your butt. We really do appreciate everybody that comes in and gives us their opinion, as long as you're not.
Let me tell you, I have never.
Lost you.
Sorry.
Hey, Lindsay.
I have never been on Seroquel, and I'll tell you what, I one time accidentally took that medication and gave
This was, you told me about this, right?
gave yeah. And I'm telling you what, I took that by accident. I was giving it to
Yeah.
somebody else and I just happened to pop it in my
Remember.
mouth and swallow it. And I mean,
Death
I think I
water.
called you that day.
Yeah,
Remember,
you
I was
did.
like, I was
Bring me a
dizzy
Death
as
water,
hell. I couldn't function.
Yeah.
I was like knocked out at like 4 p.m. and stayed knocked
Yeah.
out until in the
The
morning.
good thing with Seroquel, though, Lindsay, is if you need it, then it works appropriately. If you don't, then, it's just going to put you out in la la land.
Yeah, I did not like it at all. It made me feel like I did not like it.
I bet it did. I bet it
I was
did.
like, I did not mean to take this, and I accidentally just popped it in my mouth, and I thought I was gonna have to go to the hospital. Yeah, I'm serious. And I take 10 milligrams of Ambien, and that messed me up bad.
Yeah, she was like a zombie angel. She did. Thank you for the
Yes.
follow, Adam. Thank you for the death
I
water.
was a zombie. I was dizzy. I was like laying in bed, like, what in the hell is happening to me?
Sorry. Dexter, come here. Sorry, tried that.
Yeah, I feel like if you definitely need it, it works, but I don't need that. So it just really messed me
Yeah.
up. I
bet.
called Jen the next day and I was like, you're never going to believe what I did. And I was scared as hell.
For those of you coming in, Adam and Nev, we are about to go over the timeline, her medication list, the prescriptions, the dates it was given, and we're going to show you. And we've got a psych nurse with us here today. So welcome her in. Her name is Angel, and she said she'd be more than happy to talk with us and give you guys answer any questions. So we're going to go over the timeline, the dates, and you're going to get to see how much medication, how irresponsible this doctor was. Let's say we're going for the insanity thing. This alone would have, if I saw this, I would acquit her. Miss Hetty, with that, melatonin doesn't work for me. Gabapentin. Gabapentin's highly addictive too. Be really careful with that, but it does work. So we're gonna go over it. Give me like 1 more minute to let more people in. Sorry, not Jen. Sorry, not. Sorry, I don't know what you mean, sweetie. I don't know how to say your name, but it's so pretty.
I know. I was trying to do the same thing. I was like, Mia.
Yeah.
It's pretty.
I love beautiful names, but I always butcher them. So, but yeah, we'll go ahead and we'll start, and we'll just hello, Michelle. We'll go ahead and we'll just have to repeat because other people go in, but we're going to go ahead and start going over the medication list. So earlier today, we were speaking about it. I gave the amount of medication she was on, but not the dates. So where's my backup flower power? Oh, she probably powered herself right out. She was on.
Don't be bringing no flower power up in here now.
Yeah.
You don't need to be yelled at again.
I think she just whooped. And sorry if I got something in my teeth because I just ate ribs. So if y'all see it, point it out. All right. So Lindsay Clancy's, and this is again from the prosecution, right? This is not the defense. This is not mine. This is their list and timeline that they have put together. I'm only going to use their information to make everybody happy. So we're going to start mid-October. Mid-October. On the 16th, Lindsay was prescribed Zoloft, which is an antidepressant, 25 to 50 milligrams by Jennifer Tutts. Now, what the hell? Chad! Thank you.
I was about to yell at Liam.
I think it was Liam. So that was 25 to 50, and this is Jennifer Tutts. I want you to remember who's prescribing all this so that you can understand how we feel it's so irresponsible. On October 20th, she was given Ativan, an anti-anxiety, again, given by Jennifer Tutts. So that's 4 days later. On October 20th, she was also given Benadryl as a sleep aid by Jennifer Tutts. November 16th, which is 24 days later, Trazodone was added as a sleep aid up to 150 milligrams. That was prescribed by South Shore ER. Okay. November 21st, 5 days later, Prozac was entered into the chat, and that's an antidepressant at 10 milligrams by NP Julie Paul, nurse practitioner Julie Paul. Then on the 25th, she was prescribed Ambien. Now remember, I don't know if you guys are writing this down, but she's already been given, for sleep, she's been given Trazodone and Ambien and Benadryl and one other one. Hold on. If he opens that door one fucking time. So on the 25th, she was given Ambien. On the 25th, she was given Remeron. Remeron is an antidepressant sleep aid on top of the Ambien, which was prescribed by Julie Paul. On the 25th, the same day, she was given Klonopin, which is very strong. Hold on, what's going on with Adam? Adam, you're not being ugly, are you?
No, I'm just playing with him.
Oh, okay.
He was like, "Did you write this, or where can I find it?" I told him, "Don't start a shit. He can find it in the paperwork."
It's their list, Adam. It's the prosecution's list that they entered in. Shit. Hold on, my phone's flying everywhere. Give me a second to put this back up. Okay, so now I want you to remember that on the 25th alone, she was given Prozac, Ambien, and Remeron, and Klonopin. So I hope you guys are writing this down. So in less than 1 month, she was given 1, 2, 3, 4, 5, 6, 7, 8 medications. On November 29th, she was Seroquel, which is an antipsychotic bipolar treatment, increased to 400 milligrams a day. And that was prescribed by Rebecca Gelada. On December 6th, Valium enters the chat. Now, guys, remember all the other stuff that she was given. And we entered, now we have Valium, which is a benzo anti-anxiety by Rebecca Gelada. Mid-December, they don't have the date on, Lamisil, which is a mood stabilizer given by Jennifer Tutz. On January 3rd, her trazodone was doubled. On January 10th, her Valium, which is a benzo anti-anxiety, was doubled, the prescription, by Jennifer Tutz. On January 16th, amitriptyline, an antidepressant at 10 milligrams to 20 milligrams a day, was prescribed by Jennifer Tutz. So that is from October 20th to January 20th. So less than 90 days, she was given all of these to work with, right?
So we're I'm knocked out.
Crazy. Can you imagine? What's it like doing med finally works? It just depends.
I just flushed my toilet. Sorry. Sorry, if you heard my toilet flush, I wasn't peeing. I just randomly flushed my toilet. Sorry.
Oh, that's okay. So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, just like I said earlier, 14 medications within less than 90 days that she was given. All of these medications. Seroquel is the one that she stopped taking but is found in her system. Yes. The first 2 weeks of any new med is terrible, and they just kept piling them on, right? Why is Lindsay doctor shopping?
Doctor shopping.
No.
She went to a doctor. One doctor left the practice, so she started seeing another doctor. So it was the same practice. She wasn't doctor shopping.
Yeah, no, she was not. Any three would lay someone out 100%. They would. This was her going to the doctor and trying to get help and trying to help figure out what was going on with her. But here's Angel coming up. Great. Sorry, Angel. Hey, Angel.
Hi, can you guys
Welcome
hear me?
up. We can. Welcome up. What are your
Okay,
thoughts?
I would so I've worked inpatient psych with adults the majority of my adult nursing career, and I currently work with kids, and I work down here in Virginia. We have state facilities, and I work there, and that's where they send the NGRI patients, the not guilty by reason of insanity. So
Right.
I'm very familiar with psych meds. With that being said, I would say it's all dependent upon like how was she responding, what was she saying, oh, this isn't working, and stuff like that. So they would especially, I wouldn't say that necessarily is it seems like a lot of medication, but that's not necessarily out of the realm of normal when someone is having their first kind of mental health break.
Mhm.
My curiosity though is, did she go inpatient at all?
She did for 5 days. She admitted herself. I have to pull up the dates again.
Sure.
She did go inpatient for 5 days at her request. They noted that while she was there, which also makes me wonder if he was messing with her meds at home because of how bad she was at home, and then how when she was inpatient, she was so much better, same meds, but given appropriately, I'm assuming. They said that she did great. She had clarity. There was no mental fog, no depression, that she did really, really good. So they let her leave to go home. AMA, of course, they wanted to keep her a little bit longer. I believe there was something, again, I'll look it up, going on with the kids that she wanted to be home for.
It was a
And
birthday.
thought that she had a good support system.
Cora's birthday or something
Was it
like
Cora's?
that.
Sure. I'm just curious because in the psych setting, you do, they're called treatment teams. You do them every day with every patient.
Right.
So I'm curious as to how her treatment team felt her discharge would be and stuff like that. And the curiosity of is like her being a nurse too, like, people are saying she's doctor shopping and stuff like that. I do not believe that's the case. People don't really doctor shop unless they want to be on benzos, and it looks like she was getting them willingly because they were trying to it from looking from the outside. And like I said, I don't know all the medications and everything that has happened in the medical component of this case, but it sounds like she was highly sleep deprived. And when you're highly sleep deprived, at that point, people want to sleep. They will do what they need to do to sleep. So I don't know if they were kind of using the Ativan, the Klonopin and stuff like that to try to relax her enough to get her to sleep, because they do use anxiety meds to help you sleep at times too.
I was gonna say that because they can also give the like diazepam and Ativan to help sleep.
Yeah.
Yeah.
But I would also I would say that I think people do doctor shop for benzos, but I think it's more prominent looking for opiates.
And we have to remember that she refused medication at first because she wanted to try therapy. So I don't think there was any doctor shopping here.
Yeah, I don't
because-
either.
Yeah.
Because she Klonopin, the Ativan, the Valium, she was getting it. They were giving it to her. So
Right.
she wasn't doctor shopping in my eyes. She was just, to me, it sounds like she was desperately trying to sleep. And I believe that's probably how she was starting to feel better in the inpatient setting, because she was getting the undisturbed sleep and could relax a bit. Because in psychiatric units, you're checking on a patient every 15 minutes. So I think that just goes to show the different level of environments. If she was able to get sleep and relax while she was inpatient versus, because like I said, if every 15 minutes someone is checking on you for the risk of self-harm, suicide and stuff like that, and be able to start getting better in the inpatient and then go out and start declining again, something, the lack of support, I don't know if being around the kids was still triggering for her. I don't know. But like I said, at that point, the treatment team should have had a kind of rock solid plan for this.
Her care plan when she went home.
Correct. Yes.
I agree. And I mean, can you validate that this is, especially for somebody who's not been on this, her whole life, this is a lot of medication within 78 days for one person who had never in their life has been on any of these.
For someone who had never been on that kind of medication yet. And I don't want to speak because, everyone starts off new in the medical field and doesn't know exactly what they can root out and stuff like that. If they were doing this many medical changes, they should have tried to have hold on stuff and really get like a rock solid diagnosis at that point, because the bipolar psychosis and stuff like that, because if you give certain medicines to people who are bipolar versus psychosis, it can exacerbate.
Right.
Yeah. So they should have, in my opinion, if they were doing this many medical changes, they should have gone back to the drawing board and been like, hey, we need to find a true diagnosis, because we're playing at this point Russian roulette, right? She keeps, saying it's good days, bad days. You don't really go one day good, one day bad. When you're on the upturn, you go, okay, this isn't so bad. This isn't so bad. I'm getting better and stuff like that. So, and I'm also curious as, I have seen this before where we have involved CPS, to kind of keep keep someone in the community on it.
Yeah.
Even when a child hasn't been hurt, and to just like monitor things and stuff like that. So I'm just, I know every state is different. I'm in Virginia and she was in Massachusetts. So it's just, it goes back to show the failures, not just in mental health, but the healthcare system in the United States.
What do you feel about how quickly? Like, I feel like they weren't even their Dr. Jennifer was not even giving her a chance to see if the meds work. Like, they were just stacking them so fast. You know what I mean? Like, we're talking about 4 days between some of them. Like, didn't that seem very quick on a lot of these med changes to you? It does me.
It can, but with that being said, if she was saying, hey, these thoughts are getting more intensified, sometimes you have to, especially with psych, you have to kind of outweigh the pros and cons of it. Okay, let me throw this in and see if we can stop it. And some you can't, like Klonopin, you can't just stop taking. You have to be weaned off. And same for any of the benzos, you have to be weaned off. But with that being said too, benzos give you that drunk feeling. I don't know if people that don't have the medical knowledge that other medical, not just me, but social workers and stuff, benzos give you that drunk feeling. So if she was taking this, it's just weird how she wasn't able to sleep with all of that. Like, that's what people doze off during the day. And I don't think people realize psych patients actually take the most meds out of any kind of patient. So, I've had patients where I've had to give meds 6 times a day. To control thoughts and self-harm and stuff like that. So it's just the I think, I don't want to say it was so much the medication stuff, but I really think they should have waited to get a clear diagnosis into like, hey, let's just throw this out and stuff like that, because I know they've seen bipolar psychosis and stuff like that. So if they were just thinking initially this is just the depression and anxiety, they were making it worse if she was bipolar 1, having a true psychotic episode, or being in mania. People don't even realize, like, hey, she could have been in mania. And when you're throwing other things at that's not, it can make it worse, her thoughts worse.
For those of you who are just coming in, Angel's a psych nurse. We have Cherry here. And today, this evening, after our conversation this morning, I've got the medication list and timeline that was put out by the prosecution. So if there's people in here that want to hear it again, if you weren't here, let me know. But to me, it was startling to see how, and again, my problem, Angel, was how quickly they were just changing and adding and stacking these meds on her. For somebody who had never been on any kind of medication before, I personally found it kind of staggering how much and how quickly. But this is your expertise, so I'm glad
that with that too, I think some psych meds take up to 8 weeks to work. So, I think they, like I said, if they were so worried about, if they were at the point where they're like, hey, we need to keep giving your meds, they should have gone back to the drawing board and been like, hey, let's hold off and see what is really going off here.
Yeah, I agree. There, like you said, there was no foundation, you know what I mean, for them to build off of. They were just like, well, let's try this, let's do this, let's add that. And we have to give these medications time to work and build up in our system. But the ones that mainly I was shocked by was the Trazodone, the Ambien, the Remeron, the Klonopin. That's all within 4 days of one another. That is a lot of medication.
That is a lot within 4 days. I didn't realize it was that. Yeah, that is
the 21st to the 25th of November. And if y'all want me to repeat the timeline, I can do that. Can't the court request documents from our visits, things her and her doctor talked about? I'm sure they could, even though there is that privilege, but I don't. I'm assuming that they've asked for whatever they need. And again, this is all the prosecution. And if you guys want, I'll give a quick rundown of it real quick. So we're talking October 21st to January 23rd. And within 4 days, the November 21st through the 25th, they added Prozac, Ambien, Remeron, and Klonopin within 4 days, on top of the Trazodone, Benadryl, Ativan, and Zoloft that she was already given. They were adding these, and that was all within. So let me break it down. In 1 month, she was given Zoloft, Ativan, Benadryl, Trazodone, Prozac, Ambien, Remeron, and Klonopin. That's a lot, Angel. Right?
It is. And my question is, was she getting this through at this point, she was at an outpatient practice, correct?
This is yes. So this was Jennifer Tutz.
And
And
I'm not trying to discredit her because she is a doctor. She does know,
right.
But she had only been in practice for 1 year, correct?
I believe so. I think
so. I'm curious why, because I've seen this, and this is like the good thing about being a professional and working in healthcare, is if she was going through all these medications and stuff like that, and she thought her patient was suffering with postpartum depression or anxiety, why she wouldn't reach out to her colleagues and be like, hey, I have this patient, I'm trying this.
Right.
It doesn't seem to be helping. Does anyone want to swap a case? Or what are your thoughts and stuff like that?
I agree with you. I'm going to add in here, Angel, on the 29th of November. So in a month, they doubled her Seroquel to 400 milligrams. So add that to, I'm trying to, 30 days from the end of October to the end of November. They had, which shows me that she was already on the Seroquel. So I don't know why they didn't list that. But it looks like they doubled it November 29th. So on top of the Klonopin, Remeron, Ambien, Prozac, Trazodone, Benadryl, Ativan, and Zoloft, they doubled her Seroquel on the 29th.
And also, when you're bipolar, you shouldn't take SSRIs, correct?
You can, but they usually support it with a mood stabilizer. So she should have been more so, because I've seen where they're saying she is bipolar now, that she could be taking it, but it is like textbook. You don't give SSRIs without mood stabilizers.
They did give her one mid-December, Angel.
Mid-December after,
I always pronounce that wrong. A mood stabilizer, Jennifer Tutz did mid-December. It doesn't have the specific date. So they added that on mid-December. And so I'm so glad that we have you here because, again, this is your specialty. Psych is definitely not mine. So I'm glad that you're here to explain. I thought this was a staggering amount of medication for anybody, much less somebody who hasn't built up this tolerance in her system. And it just doesn't seem like there was any rhyme or reason here. Mm-hmm. You know what I mean?
Because like I said, after the first 6 weeks, if she wasn't feeling better with the SSRIs, they should have gone in there and been like, okay, we need, like, what else is going on here? Because this is more than just depression. Because like I said, she was having thoughts of not only hurting the children, but hurting herself, correct?
Yes.
And that because I've dealt with mothers that have shaken their babies and stuff like that and come to the psych ward. That's how it happens and stuff like that. And it's not so much of like, I want to hurt myself. It's like, I need this to stop. I'm on my brink and stuff like that. So the fact that she was saying she wanted to hurt herself, that is like a red flag to me. Mm-hmm. It's not like I need to get away from these kids and stuff like that. It's that I would have been like, okay, that right there, I would have been like something that would have pinged my ears, to say the least. Just from the experiences, I've dealt with and stuff like that. I would have been like, well, why do you want to hurt yourself if this is just, postpartum depression?
Right. Yeah, it doesn't seem like it. I wish they would have done this inpatient and got her leveled out at least before, instead of just sending her home with this plethora of medications.
I agree to that too, because like I said, I don't know the extent of saying like how she wanted to hurt the kids, how she wanted to kill herself and stuff like that. But at that point, if she was my patient, I could have requested a temporary detention order on her and got her committed
Right.
until the team thought she was safe to go home.
Right.
So, because you can request to leave AMA in a psych unit, but at the end of the day, if there's especially a risk of a child being hurt, like, we can stop. It's our part as a community, as a medical professional, as us as a society, to try to intervene before something like this happens. And that's where I'm like, what happened? Like, where were these people at for her?
Mm-hmm. That exactly. And where was the medical team at for her? If Jennifer was that new of
Agreed.
patient, like, I think there's a lot of mismanagement on her part here, just a lot. And I could see, and again, I don't think that she did this to begin with, but let's say she did. The over medicating that I'm looking at here, to me, it was, it's really got my attention. And I think that there should be some accountability just for that alone. You know what I mean? Like, this is a lot of medication, and Jesus, like the Klonopin, the Ambien, the Trazodone, Ativan, all stacked on top of one another, the Valium, that is a lot of meds. I don't know how she was upright, much less.
Yeah, if she was taking, there's no way she could have been taking all of all those benzos together, because she would have been comatose. She would have been just out.
Yeah, sleep wouldn't have been an option, because it would have just knocked her the hell out. Like, medicine is still medicine, guys. Like, now I have seen too much medication do the opposite effect, just wire people out because they're over medicated. Maybe that's what happened. But I mean, even that would be so rare to happen with this much in your system. I mean, I just don't see how she'd be upright, to be honest with you. I just don't.
Yeah, with all those benzos, there's no way. There's no, in my professional opinion, there's no way.
I don't think so either. User, it doesn't have anything to do with women or men. I mean, that's a crazy statement for you to make. And if you're going to be disgusting and rude like that, then I'm going to block you or mute you from the live, because we're not having that kind of nasty talking.
Yeah. No, I agree. No one is. We're trying to help get a discussion around mental health. Yeah. When I was working at the state hospital, one of my favorite patients, he was actually a Navy veteran, shot his 4-year-old son point blank in the face. Oh my God. The son did not make it, and he is on the NGRI, which is not guilty by reason of insanity. One of my favorite patients ever, and you would never know. Because, and I don't think people are like, oh, she will never be free from this. If she's NGRI, like I said, I know every state's different. In Virginia, if you get NGRI status, you're followed for the rest of your life. You get checked in. We have services boards here. The service board checks in with you a few times a month. Like, this is not us saying she should walk free. This is how do we prevent this in the future? How do we support such a terrible situation that has come?
Right. Yeah. And this is a mental health discussion. I'm glad you said that, because I feel like she was failed. I truly believe that the medical community failed her. And I hate to say,
she got a phone call, so just give her 1 second.
Sure.
Sorry, y'all. I had to answer that. I thought it was one of my patients. I think the medical community failed her, and I hate that because I work in it, you work in it. I mean, and in a lot of women, and somebody had said something about the CPS when you mentioned that. Although I understand what you're saying, Cherry was saying, that's why a lot of women don't come forward because they're scared of losing their children, and that shouldn't be a fear. That should
Agreed,
never be a fear.
100%. It should never be a fear of trying to get help and keep your kids safe.
Right. No, it shouldn't. And do you, working in this field, do you find that is something that your female patients share with you, that they are afraid of losing their kids or families over?
Yeah, they say I don't want to say anything that'll get them taken away.
Right.
And I think too, if I stay relevant with this stuff. If you look at other countries, especially I just compare us to Europe just because we're about the same and stuff like that. Why do they have lower rates of depression and anxiety after postpartum? Oh, because they send people into the house to help and
Isn't
stuff
that
like that.
crazy?
We
I
had someone
heard that
on live
last night.
yesterday. Yeah.
Yeah, these countries have lower rates because they understand the exhaustion it puts. And I'm not discrediting dads because there are dads too,
Right.
but mothers tend to take the brunt of everything. And that's why for a year they have like a nanny that can come in, do laundry, cook, and watch the baby while they sleep and stuff like that. And we don't have that benefit unless you can pay for it in the United States. And
They also keep their mothers in the hospital for like 5 days.
Yes.
Instead of 24 hours, they're like, you're out of here. That's insane to me that we have gotten to that point where, even C-sections, they're like sending them home within less than 48 hours of having a baby.
Right.
Lack of sleep alone can cause psychosis. It can, 100%. But
without a doubt.
Heard last night, we had a guest up. She's an Australian. She actually works with the state and on a federal level, I guess is what you'd call there, about these kind of systems that they have in place to go home with the mothers to make sure that they've got the care that they need, and extra support. I think it was for 18 months, Cherry, was that what she said? But it was amazing to hear that. Too, that they have that, and we don't have anything like that. But I'm glad that you verified that women, they are afraid to talk about.
Without a doubt. I mean, if I came to you just even as a normal person and was like, hey, I'm having thoughts of hurting my kid, right. that doesn't sit well with people, right? Like, so there's so many I wonder why the family wasn't more involved. I wonder, I know they had like a nanny or a helper, but was only there while he was at home working, from my understanding.
Right.
And not only that too, like she was a nurse too. So you have to think she was giving all of herself to her kids. She was giving all of herself to her patients, and then what was left for her?
Right, exactly. We found out in the trial that he didn't think the nanny was necessary because she was a stay-at-home mom. The in-laws even offered to take the children for a week to give her some respite, and he denied it. He said that they didn't need it. It's why wouldn't he want to support her and let her have the extra help that she was asking for and people were offering? Even his father got on the stand and said, they asked him, who told you no? And he said, my son did. Just said no. Sorry, people aren't coming in because I got for 10 minutes, nobody can see the live. So if I keep repeating myself, it's just because I'm kind of waiting for people to be able to see the live and come in so that they can catch up with us, guys. But it's almost like he set her up for failure to me, like I don't know.
Yeah. I don't know everything about it, so I hate to use the word set up, but he definitely did not support. I will 100% say that. So if you're not supporting, then are you inhibiting? Like,
right. And why would he be crushing the meds, Angel? She's a nurse. We know. that unless you're just trying to get, your meds hit you real fast and you
The
can get real
only
hooked up.
reason I could think someone would crush their meds is as if they can't swallow pills.
Right.
You wouldn't want someone to know they're taking pills, right? You would not want someone to know that, because like I said, if she wanted to like get a high off of them or something like that, why wouldn't she crush and snort them?
Right.
That's exactly what I said. I was
That's
like,
what
we
I said.
all, we all know, let's just go old school. Let's just
Yeah.
crush them and snort them. Why are we crushing them and putting in our drink? Because one, you're not getting the full effect of the medication that way. It's not really. I mean, yeah, you're getting some of it, but it's not helping you. It's not hurting. What's the point?
Right. And not only that, I would think too, this is the thing too. We as nurses know if you administer a medication differently, it can deactivate the ingredients in it.
Yep.
So someone who is not privy to like the administration of medications, if they didn't know that, they might not realize like, hey, I can't give this medication crushed.
And these medications, guys, aren't the ones that, she's going to sit there and get high off of. When they hit her system that fast, they're going to just knock her clean out. I mean, we're not talking about an opiate here where, she's going to get high off of it. These are benzos. They work completely different. And to have them hit her system all at once like that, they're just going to knock her clean out is what's going to happen. So, I don't think I don't think she was crushing her meds. I mean, he already admitted to doing it, but why? Why? Unless he was hiding the amount and what he was actually giving her. That's my thoughts here, is that's why he was doing this, because he was hiding the amounts and what he was actually giving her. And yes, Adam, it did. I have heard that some of them were DC'd, but they were still refilled. So these meds were refilled these 3 months. These are medications that she actually was able to go and refill and add and subtract to her medication regimen. So these aren't ones that were given and then taken back. She actually filled these prescriptions from what this says. And again, this is from the prosecution, not the defense. So that's my thoughts on it, is that I think he was over medicating her. And coming to the day of the unalivings, I think that she has zero recollection because she was so over medicated. I think she was knocked clean out. And again, why she was so brutally beat up wrong. She didn't do her wrists wrong. She didn't do her neck wrong. Although they were 3 millimeters deep, which is deep, you guys. Like, that's not a scratch. That's kind of deep. And the crushed whatchamacallit, oh God, you guys, I've said it so many times today, thyroid. I feel like that's why she doesn't have any recollection, because he crushed so many of these. He knocked her clean out. And that's how she was able to lay in that snow for a lot longer. We did a timeline earlier, Angel, where we broke down exactly the minutes that she would have had. The longest she could have been in the snow was 14 to 15 minutes. When she got to the hospital, her core body temperature was 82.
Yeah, I heard that. There ain't no way. There is no.
And they had already been doing the warming techniques with the bear hug blanket and everything. So that tells me when they first found her, her body temperature was probably around 78, 79, because they do have to warm you up slowly for everybody.
Right. Correct. Yeah.
So there's no way.
The thing, let's say, there are cases in medicine where things happen that there's no explanation. People that are on their deathbed then pop right back up and are cured and stuff like that. This is the thing, though. When I've seen a patient that out of it, that's sick and stuff like that, they can't respond to you and say, oh, I did this, or where is this, and stuff like that. They're usually saying like nonsensical comments. Like, they're sometimes asking for their mom. They're sometimes saying like Superman or something like that. So could the temperature, let's say, on some kind of fluke it did happen, but there's no way she was mentally coherent.
And we know she had a TBI, Angel. I don't know if you're aware, but when they found her, she had spinal and brain fluid seeping out her nose. She had 5 broken ribs that punctured the lungs. They siphoned 300 milligrams of blood out of her lungs. the crushed thyroid. You know, there's so much damage to her little body that she didn't speak to anybody else, but she said, and I read the quote out earlier, it was something along like, I did it and the kids are in the basement. It's just not possible. But on the timeline that we have here, and pardon because I couldn't write on the other side because I got business stuff on the other side, but we did the timeline and it gave, what was it, y'all? 14 minutes to lower her body temperature to 78 to 79. It's simply impossible. Again, unless it's some weird medical fluke that they'll figure out one day. I just don't see how it would have been done.
Yeah, I don't
even with the spinal cord injury, which we know
even spinal cord injuries.
Yeah, within a couple degrees. We're not talking a lot.
We're not talking like 10 degrees. This is like, because what people can be outside for how long and still their body temperature isn't that low when they're found and stuff like that. Mm-hmm. So it's just very, as far as like reasonable doubt, I think there should be enough at this point. Yeah. But I don't I know people are saying mean things about her that was this premeditated and stuff like that. In my eyes, no. I
don't think so either.
And this is the thing too with psychosis. People present everybody presents very differently with psychosis. I've had patients that, especially when I've gotten nursing students, and this is the good thing about it, I've had my nursing students go up to patients and talk to people, and they're like, "Oh my goodness, what is wrong with this person?" And I'm just like, keep talking to them and stuff like that. Mm-hmm. And then it's always finally revealed. They'll be like, "Oh, like I'm king of the lizards" and stuff like that. and no one knows until you're actually sitting there talking to them. And when they said Patrick Clancy said that she was having a good day that day, I'm like, who are you to be the interpreter of what a good day is for her mentally?
Right.
What is your medical training? What did you ask her? Are you having these thoughts? Are you feeling anxious? Do you want me to leave you? Like what?
Should I leave you when you're in a fundamental state overall the last 3 months?
Right? Like who was he to make the assessment she was having a good day? Like what would be a good day? Just that she didn't say anything, that she was up walking around? Like what was your definition of a good day?
Yeah, exactly. And here's another thing I'd like you to answer. Again, being a psych nurse, Angel's a psych nurse. If she was that incoherent, he only left, I want to get my numbers right because you guys will yell at me, 34.5 minutes is what we can estimate. And she was that incoherent at the time that the EMTs got there. There's no way that the 34 minutes before that, she was up and lucid enough to murder 3 children, slice herself up, crush her thyroid, move a king-size bed, and toss herself out a window. When did, how? I need to know how, if she was that incoherent.
That doesn't make sense either, because like I said, from my understanding is like there was no excess levels of any drugs in her system, correct? Mm-hmm. Everything was within a therapeutic range. And just because it's within a therapeutic range, we know doesn't mean it was truly therapeutic. We just know that she wasn't overdosing on it. That doesn't necessarily mean it was working. We just know that it was not out of the range of, she wasn't taking enough or she had taken too much.
Right. And what you're saying, I'm going to add on to that. So every medication was within the therapeutic range, but she had so many of them together combined that each level was, you know what I mean? But that would be fine if she was only taking 1 or 2. But when she had all of these in her system, you see what I mean? There's no way to me that she could have been coherent enough to even commit this crime if she was that incoherent when they got there. Am I saying that right?
Correct. Yeah. And this is the crazy thing too, like going up and down the stairs and stuff like that. How coordinated would she have been able to be in that moment? Because this is just from experience. my personal experience, not to say it couldn't happen, people who are in psychosis having this, they're not doing such meticulous
Right.
things. Like I said, everyone I've seen has been gunshots, stabbings, and stuff
Mhm.
like that. It's not, I'm using this exert force, because your brain is so dysregulated that you don't I don't want to say that you don't have the gross motor skills, but they're not activated. I've never seen it being activated in that situation. I've never had
I agree.
someone like, I've never seen where it has been like strangulation or something very like that.
Right.
It's always been like a gunshot, a stabbing,
Right.
something quick and fast, because
Exactly.
your brain wants to get it over with. Like, I want to get this out, not like let me watch this happen and stuff like that. And
Exactly.
even with the case that was popular, like what the Andrea Yates and stuff like that, it wasn't an exert a true amount of force that she had, because it was little, it was quick and fast. And to me too, when I learned about, they were able to take the baby back and stuff like that, if she wanted to unalive the children, she could have checked the baby's pulse and known that there was still at least something for them to be able to
Right.
bring the baby back and stuff like that.
Yeah.
So it just is very, like I said,
It's hard, right? To wrap when you start thinking about it and putting it
Yeah.
all together, like, how did this happen in 34.5 minutes? And that was stretching it. That if she was that incoherent with at the time they found her, how was she so coherent, even if she was in psychosis, enough to, like you said, methodically? This is not like a quick jabbing or stabbing or, pew pewing. This took thought and time and patience and strength to strangle somebody, y'all. This is not something that is done quickly. Again,
Mhm.
hence why Chris Watts murdered his children twice. He strangled them once before Shanann got home, and he didn't do it right. He just, incapacitated them. Hence why they came walking in when he was wrapping her up in a sheet. And those are his words. He told, everybody that he'd done that. He incapacitated them, but they came back. They weren't ever gone, to be honest. You know what I mean? That's what I'm trying to say. There's no way that with her being that out of it at the end of that 34 minutes, that she would have had it together enough to do all that. It just doesn't make sense, right?
And people in psychosis don't have a good understanding of time.
Right.
Like, she could not plan mentally, okay, he's going to be gone for 34 minutes. I have exactly X, Y, and Z to do this. They're always asking, what time is it? When am I going to have dinner and stuff? Like, when is my medicine and stuff? Because, like I said, the brain is so dysregulated in that moment.
Yes, 100%. I'm so glad that you're up here. I've only had one medical professional and this whole week that's come up and told me that every bit of that was possible, and that it was possible to lower your core body temperature to that degree is within 15 minutes. I've asked every doctor I know, everybody. I'm like, make me understand. Again, I've seen weird shit in the medical field, so I get it, but it just doesn't make sense how they're going to try to say that she was able to do all this in 34 minutes, along with the damage that was done to her own body. And then I had a nurse, I was working hospice the other night, and I could not figure out the crushed thyroid. I was like, how did this happen? How would she have done it? And it was just so simple.
Have they given an explanation to how she reportedly did it?
No, but my friend said, she was like, Jen, I think he tried to snap her neck. That's why he threw her out the window, because he was going to do this, and he didn't have the know-how. It's not just easy to snap somebody's neck, unless you know how to do it. So in that attempt, he probably crushed her thyroid. And when he dropped her out the window, and again, her back injury was not, it was a compact break, so not an impact break. So when she fell, and again, she only fell from 15 feet, but when you're upside down and you go top down, that compact, that's what broke her back and snapped her spine. So I think that he thought he would break her neck and then toss her out the window and make it look like that's when it happened, but it didn't. It just broke her back. And that's the only thing I can think of, is how that that thyroid got crushed. I didn't even think of it. She did, but she was like, I'd put money on it that he tried to, to snap her neck. And that's why he was going to throw her out of the window. And well, Adam, that's what you think, that she threw herself. But again, if you're going to throw yourself out a window, you're going to go outwards. Your wrist and your neck aren't going to rub against the side of the house halfway down and get blood on the side of the house unless you're being dangled out the window and rubbing against the wall.
And the argument, and this is like proven, when people do unalive themselves, at the brink of the end, your body tries to save itself, right?
Right.
When people do whatever, instinct kicks in. She would have braced for impact,
I was
right?
waiting for you to say that. I was
She
praying
would
that's
have
what you were going to
braced for
say.
impact.
Right.
So like a broken arm or something would not have, like, that would have been like, okay, she did it and stuff like that. So like she dove out the window, like even diving down, her eyes would have seen the ground and
Right.
she would have braced. Like
Exactly.
there's
Without, even if she tried not to, her
even if
body
she
would have
tried
just-
not to, yeah. Even if she thought, it's, I did this like little crazy bungee jump thing. And they said, listen, don't put your hands out. You're going to fall. You're not going to touch the ground. Don't put your hands out. They immediately pull the ground out. What did I do? I braced for impact.
Right.
You know what I mean? Like,
because your body is just instinctually going to try to protect itself. And she
Right.
had nothing, no wounds to her hands, no wounds to her wrist, which tells me that she was dangled out of the window, and that's how she landed directly on the top of her head, giving that impact break, not impact, what I said earlier. Sorry, I've been talking about this so much, from hitting the top of her head. And that's what he thought. I think he was banking on, is that it would look like, she broke her neck going out the window. It was only 15 feet, guys. It's not very far.
even if she was under psychosis and wasn't acting natural, her instinct would have kicked in.
Mm-hmm.
The instincts naturally kick in, even in psychosis.
Yeah, 100%. I'm
Like
glad
when
that you
there's
said
been
that.
fights and stuff like that, even people who are psychotic, when they see people fighting, they don't try to get into the mix of it. They just don't stand there. They back up because they know, I don't want to get hurt. Like,
Right.
it's not like, this is like, we're talking instinct versus mental clarity now. Like, even when people do things like that, they grab at their throat if they're trying to do whatever, because it's instinctually at that part.
Right. Exactly. And so that, again, that's another thing that if it doesn't make sense. And again, I went into this last week, I just thought we had another Andrea Yates on our hands here, which is terribly sad. Andrea was one of our neighbors. I grew up in Clear Lake, Texas. So
Okay.
I didn't know her, but followed her case and my mother-in-law worked with her husband, Rusty. So if just the medical field failed her desperately. I really thought that's what we were looking at here. But then all of this starts coming out. And I think every medical professional that's been watching this, something just didn't jive about it. It just didn't make sense. And I cannot get any of this to make sense. What would you think would cause the crushed thyroid? Sorry.
Me?
Uh,
I would think something or someone had to have crushed it. Like, it just doesn't happen. You don't get, that's not a symptom of mental health, right? Like,
okay.
so he, herself, someone either, and you don't try to unalive yourself by choking yourself out, because as soon as you try to choke yourself out, what happens? You pass out and you start breathing again.
Right.
So unless there was evidence which like, I don't know all the evidence where she took a belt and was trying to hang herself or unalive herself with the bands or something like that. I don't know. I know people were saying maybe he had put her in like the window seal and then slammed the window on it or something like
Right.
that.
Yeah.
I don't, that could have been a possibility, but like I said, I'm curious, like, why there's been no medical explanation as to, the crushed thyroid. Like, where is that coming from?
Yeah, that's the only thing that we could come up with. And again, it was a friend of mine who's a nurse. She was like, I think he tried to snap her neck and was going to throw her out the window, and it would have looked like it broke from the fall, but it didn't. And I think he banked on that he did unalive her when he threw her out the window. I think he thought she was unalive, probably by doing this to her neck. And then she wasn't when he came back. And what else can you do? He's already slit her wrist, her throat, crushed her thyroid. Her lungs are full of blood. She's got a TBI. I mean, the fact that this would be like Shanann Watts coming out of that 18-inch grave when he killed her. Like, by the grace of God, she's not dead. The damage that he did. And for somebody to do that much damage to their own body, you know what I mean? Like, that's incredible.
That
amount of damage.
I was just thinking too, maybe he tried stepping on her throat after she was out the window because she wouldn't have been able to protect herself then.
That's true. Somebody else had said that too. Oh, hi, Katie's coming up. That's true too. But I'm thinking, would he be scared of them finding the boot print on, or maybe the shoe print? But he did change shoes too. So, hi, Katie.
Hiya. I just wanted to say, for everybody that's still saying, oh, Patrick can't have done that, and oh, she admitted it, and all this sort of thing, the only person that heard Lindsay speak any words after all that had happened was supposedly Patrick. And yet everybody has literally run with what Patrick said, and I don't understand that.
Right. And there was never an investigation.
All the first responders have categorically stated she was incapable of speech due to a crushed thyroid, which, by the way, I'm an ex-army medic and an ex-nurse.
Yes, thank you.
I have never seen that injury from a fall, and the amount of falls and crush injuries that I have seen would turn your hair white.
I can
I have
imagine.
never, ever seen anybody with a crushed thyroid because of a fall. It just wouldn't happen.
Right. Another injury that we cannot explain. that is
Exactly.
not
And
within-
big king-sized bed that was moved well away from the window.
Right.
She supposedly did that without blinking when she's got cut wrists, when she's got a cut throat,
Yeah.
and then jumping out of the window. No, there's blood all down those walls and the shingles. She was dangled out of that window and then dropped.
Because if she was held out by her ankles, then her face and her wrist
Yeah.
would have been against the house right at the
Yeah.
mid-level where they said that the smears started.
Exactly. I mean, you think about it. If you're throwing yourself out of a window and you are that weak, you would probably sit on the windowsill. You tip yourself forward.
Yeah.
There may be a little bit of blood on the windowsill, the window frame, if you like, where she's holding on before she goes. But it's simple physics. If you jump off something, you're literally jumping away.
Right.
Mhm.
Yeah. Not rubbing down the wall unless you're trying to climb
Exactly.
down it.
It's just there's so much of this that doesn't make sense. And if it wasn't Patrick, then there was a third person there.
Right. And again, were you in here earlier? So remember yesterday or the day before, I was saying I'd love to see if her cell phone disconnected from the Wi-Fi.
Yes.
If you
I
took
think
her
it's
phone.
very strange that a self-proclaimed tech guru.
Yeah. That day.
Why
I
that
found
day
out,
were the nanny cams
Katie,
not
that the Wi-Fi
working?
was down that day. I didn't
Oh.
know that when I said that, but now they're saying that he's reporting the
The nanny
Wi-Fi and
cams
the
weren't
cameras.
working. The doorbell cam wasn't working. Well, how convenient.
Isn't it?
Yeah.
Isn't it crazy?
I don't believe in coincidence to such an extent. I really don't.
Not this many, right? Like
No.
they just
And
keep
this-
coming.
And just to interject, like if you were worried about your partner having these mental health issues and you needed to leave the house and stuff like that, wouldn't you make sure everything is in working order and be watching
Absolutely.
remotely? Like, hey, I know you're struggling. I'll go get us dinner. I have the cameras on and stuff like that. You know, if you need help, just yell out on the camera and I'll come right home and stuff like that.
Yeah.
You know, like it just like everyone is saying, like it just doesn't make sense. Like someone explain, you know.
I mean, we're not in the Victorian ages anymore. You don't just take the husband's word for it that the wife is crazy
Right.
and then lock her up in an asylum
And they
for the
did
rest of her
though.
natural life.
Hi,
I know,
Shane.
exactly. I mean, have we gone back 100 years? I know
Jane-
Massachusetts is bad. You just have to look at Karen Reed and the Latasha case and the other one. I can't remember. They said she committed suicide and turns out a
really?
cop killed her.
Yeah, people
All
have been
in
saying pretty bad.
Massachusetts. I mean, really?
Shane, you're the nurse that's in Australia that is building
That's
the program so that at-home mothers, correct?
Yes, yeah. So
Love that. Tell everybody about that again.
Awesome.
So I've been running a private business where I go into the house and support mums when they're in crisis, or mums and dads when they're in crisis, and that might be because baby's not
Grab my
sleeping. It's
charger. Keep
generally because baby's not sleeping. That's the general sort of startup. So I go in and we have an intensive program, which I call prevention over management. So we make sure that this is very much not about me going in and fixing things and then just leaving them in the lurch. I go in and we build, it's tool setting, and we build skills for the baby so that they're comfortable to play in their cot, and they're comfortable with mum walking out of the room. They can predict her behaviour. They're not so clingy. They can be put down on the floor, just things like that. So we also work on the skills for mum and dad if they have past traumas, and we work through things. We have some backup tools when we're feeling overwhelmed, and we create a network around them as well. And then once I've got baby sleeping and then we establish a daily routine, there's a sort of a sense of calm that comes back to the house. And I've been doing it for 35 years, and this case really doesn't make any sense. In terms of the thyroid, one of the things that has been going through my mind is that, there's no ligature marks to suggest manual strangulation, but a crush injury can certainly happen with a chokehold where they're using their forearm
That's what
around from the back of the back of her head.
Yeah.
If he was standing behind her and he had her in a chokehold where he wrapped his arm around her throat and then used his other hand to pull on his fist,
Or a
that would
sleeper
create
hold.
a crush
That's
injury
exactly
without.
what the nurse was saying.
Sleeper
Yeah.
hold as well, because if you hold that chokehold too long,
Yeah, sleeper hold,
it turns
chokehold,
into a
same.
sleeper
Yeah.
hold, and that might explain how he had to move the bed, or whoever it was had to move the bed to manipulate her over to the window, because it's not easy lifting a dead weight.
Right.
Yeah, and I do think that bedroom is very staged. To be honest with you, I don't see any way she could have climbed out the window. I have
No,
gone
I don't
over it
either.
so many times because the placement of the bed with the table behind it under the window would have required her to hands and knees climb over.
Yeah.
And we have one handprint, which, if he's covered in blood, is his. And they said they've got no fingerprints from that handprint. Is that correct?
I'm not real sure, but I can look it up.
I'd be really curious to know whose handprint that is. To have one handprint, if she's got to climb over the bed with a 1/2 meter gap between the bed head and the windowsill and a small table in
Go for
between.
it, Sammy.
I think the other thing that's concerning me is that we're all confused about the timeline, but again, we're using his references to how the afternoon looked. So, everyone's gone, oh, it's got to be from when he left until when he returned. But we know there were drugs in the baby's system. We know there were excessive Seroquel that she complained made her too sleepy. And she had been off Seroquel since the 5th. She had been weaned off on the 5th. So why, if Seroquel is the one medication that makes her sleepy, and that was also found in the children, is there not a timeline where we can actually start looking at the clock way prior? Maybe they weren't eating nuggets and broccoli. Maybe they had been, sedated much earlier in the evening. Maybe she was already out the window, on the floor, room staged before he even left.
Yeah.
The other thing that is really confusing is that his alibi relies on the fact that he placed himself with a phone call, and he placed her with the phone call from the pharmacist to say they didn't have the name brand. We now know he picked up the name brand. So what was the phone call for other than alibi purposes?
Exactly.
And the other thing is, that where she was outside of the bedroom window, in the police report, you'll note that when he screamed, the policeman was directly looking into, as soon as he screamed that she'd killed the kids, the policemen were able to look directly into the window and see him on the floor where the baby was lying. You could see the children from in the basement from where she was lying,
Right.
and the light was on.
Mhm.
And that was reported, so he didn't have to turn the light on. It was already on. And so
See them.
they were visible from outside for the entire so-called 9 minutes. I'm questioning whether that 9 minutes when he got home was when the children were, while they were sedated, which makes much more sense. We were talking yesterday, we have older children who would be fighting for their siblings, you know, or
Right.
really making a lot of racket. If they're heavily sedated, this manual, you know, the tie
Right.
is more possible, and it also explains her hypothermia, and that perhaps this timeline is we have far more time to consider these crimes happening over an extended period of time,
Right.
which is why maybe the baby's being done at the last minute when they were pretty heavily sedated, and being able to bring the little tiny one back
And it
makes
explains
a
the
bit
body
more sense.
temperature.
That must
if
have
he
been
was
very,
out.
very recent before the first
Yes, I think
responders
that
got
was the
there.
last thing he did when he got back.
Mm. He
And
probably,
the other
I
thing
mean, that
is,
was the baby. So, I mean,
yeah.
oh, I can't bear thinking about it.
And that would help me understand that how her body temperature was so low. If he had done this and she had been laying out in the snow for an hour or
Exactly,
two,
that
even
body
then,
temperature. And I know the spinal injury can affect body temperature, but I've personally seen somebody who was lying on Mount Snowdon overnight and they weren't that cold.
yeah.
Yeah, the timeline, I think we all have to reframe our thinking about, instead of going, oh, he left the house at 6:05, I think this had been going on for far longer. The amount of time it takes medication to get into the bloodstream also needs to be considered, particularly in terms of the babies, because they were obviously deceased. And so the concept of them processing medication and having it in their circulatory system post-mortem is obviously negated. And so they had been medicated fairly long time before they were unalived. So
Yeah, and that
I
would
don't think the
make sense
timeline makes sense.
in the lemonade too, if he was able to get them to drink the lemonade. Now, I didn't know that they found anything in the children's system. I hadn't read that or seen that, so that's news to me. But that makes a huge difference as well.
So it was mixed with lemonade, and citrus can affect.
Right.
And just to go back, like what I was, to go back to what I was saying, what also doesn't make sense to me after working with like NGRI patients, like I told you, you know, they'll use pew-pews, they'll use knives and stuff to hurt whoever they're targeting. What doesn't make sense to me is she used the knife to hurt herself. Why wouldn't she just use the knife on the kids at that point? You know, why, like that, like I said, you know, the man that with the gun, the man with the other man with the knife towards his mom and stuff like that. It doesn't make sense why she would say, okay, let me try something so hard, but now I'm going to do something so easy to me.
Right.
And she also did it incorrectly, and she's a nurse.
Right.
Correct. And not only that, you know, we talk about like crimes of passion and stuff like that, you know, it takes an exert amount. People who are psychotic don't take 5-10 minutes to unalive someone. They want it instantly. They want that person gone, whether they think they're possessed or they're trying to hurt them or whatever. It's not like, you know, I'm doing
They're not
this,
making
no.
sense and
Correct.
methodically doing
Also,
things.
if I
I
can
think we
just
saw that in Perez Hilton the other night. That's what psychosis looks like, guys.
Yeah.
What we watch with Perez Hilton, not methodical planning and holding somebody. You know,
Right.
it's just not.
I also think something happened that afternoon. She either had definitive proof that he was having an affair. Something happened that made him think, I can't go on with this anymore.
I agree. I think they had a fight.
Yes.
And then he started, you know, with her, and then he's trying to finish it off.
Yeah,
it's
and
got
also
stuck.
manual schmangulation is a very, very, very personal thing.
Correct. Yes.
Yeah, it is.
I think using the
And it's a man's way of doing things too. It's not
Yeah.
something a
I
woman normally
agree,
does.
and
A
it's a
woman would
it's a
not have
yacht-
the
it's a-
strength in her hands, especially not if her wrists have been
Right.
damaged.
Well, and he was into ropes and knots and
Was he?
boating, and he did a course in knot tying.
wow.
Nautical
And it
knots
definitely-
yeah.
Yeah, it makes more sense that would be a modality he would use, and we discussed that the other night.
Mhm.
It would not necessarily be a modality that a mother who couldn't even do sleep training because she couldn't bear to hear her babies crying would use such a torturous, slow
Exactly.
modality of death.
You had to
So-
watch them suffer. You have to remember, to watch somebody be unalived by strangulation. You are watching suffering and fighting, and just everything in your body is fighting to stay
Mhm.
alive.
Yeah.
This woman couldn't even sleep train her babies. She wrote about it. She journaled about it because it was breaking her heart. And she was a nurse, you know, and she was referring back to the doctors, but the doctors say she was struggling with this so much. And you're going to tell me that that same woman had it in her in this state and with all these drugs in her system to sit there and stare
All
at
these
her baby's
injuries.
eyes. Hmm.
All these injuries.
Right. And all these injuries, even if she did it before she was injured,
Yeah.
to watch them struggle and scream and grasp at her and cry and stare at her in the eyes, and for her to do that, it just doesn't make any sense.
And also, there's the 4-month time frame of moving on. I mean, damn,
yeah.
4 months, and he was living with another woman. I mean,
Yeah.
Well,
and
there's
we
some
had the runner
reports
up
coming out.
yesterday from the club. Were you up here, Kate, when she came up? One of their club members, they have running clubs, said that it was known in the club that they were
Yeah.
canoodling, that having this, you know, affair in the background, and all the friends in that running club are still their friends to this day. They moved along with him and her after the Schmurders. So it wasn't something that wasn't known amongst their peers that they were.
yes, they did get married this year, Adam. You're right before this trial started.
Right. So they can't testify against
Exactly, but they were shacked up together within 4 months of this awful event. Now, I'm sorry, you can say that men move on quickly, that men have different emotions, that men don't show grief in the way that women do, but I'll tell you what, 4 months?
Yeah. Even a year, it's like your whole family was annihilated. Your wife is in the hospital, and here you are thinking about.
We're not saying that it does. However, it's also part of the bigger picture,
Right.
KF23.
And there's a lot of the bigger. Okay, there's a lot of this big picture, and you know what I said earlier, and it scares the shit out of me, is that no matter what you say to some of these people, they're not. They came in. They this is what they think, and there's no talking.
Apparently, Adam
How-
knows that she
They-
did it face down to unalive them. Quite how Adam knows this, I'm not sure. Maybe Adam is psychic.
Right.
And I'm sorry, 4 and 5-year-olds. We, you know, when my work in the home is to work with distressed families, and if I have a 4 and 5-year-old, there's no manual management of a child unless they're in a self-harm state, and you're fighting for your life to hold them in any position. You are fighting for your life, hoping you're not going to get your teeth knocked out.
That's true.
You can't just lie a 4 and 5-year-old on the floor and have them cooperate with you as you strangle them with a
Again,
rope.
referring back to
were
Chris Watts,
sedated.
go read his testimony about unaliving Bella and how strong she was and how
Yeah,
she
she
fought
fought bit
for
of
her
time
life.
off.
Yeah, they don't call it fighting for your life for nothing.
Exactly. And she didn't have that in her. She had just lost 15 pounds in 1 month. She was a tiny little person. And
if she was on her stomach, why were they found face up? And when the police witnessed through the window him untying the babies. He was untying them while they were face up. So was the knot at the front? Was the knot at the back? What
And why a
was the
nautical
knot?
knot? Why a nautical knot?
Why a nautical knot? Nurses don't use them, actually. It's not a
No.
part of their training.
No,
So
we
she's
all
in a
use
state
that
of
quick slip knot that you
psychosis.
put on an IV with.
Yeah.
That's pretty much all you're getting out of anybody in the medical field, not a precise nautical knot.
And if she was in a state of psychosis, she'll be doing things that are autonomic. She
Yeah.
won't be, strategic, because the part of the brain that's functioning is the fight or flight part, and nothing rational feeds through that part of the brain. So that's why when we know they're in a state of psychosis, things are only autonomic. They're not.
And it also, to me, it's if you're in psychosis, chaos rules, doesn't it?
Yeah.
You can't go through and you can't do step by step by step by step, then do this and then do that, and no, it's
No.
utter chaos.
And another nurse in the
No.
comments said she would have used a quick release, not that, just her, our habit, would have just kicked in and she would have done that. It's not something that she's going to take the time to do and tie a precise nautical knot. I mean, there's so much here, y'all, so much that, if it were just one or two things, that could have been happenstance. But when you look at this big picture and you put it all together, I think we're seeing exactly what happened. And y'all keep saying, well, she's, got the plea of insanity. I honestly think that Reddington's going to flip that all this week. I think what he's doing is he's building up to show us how she couldn't have done it. And he's going to show us exactly who did and
And
how.
I think he's also showing Lindsay that she couldn't have done it.
Yeah.
Yeah,
And
there
I think
was
she's the only
one
one-
sort of realization moment in Lindsay's eyes where you saw, she's been very flat affect for almost all of this trial, apart from as soon as her babies are mentioned, she's heaving, and sobbing. But otherwise, she's sitting there very flat affect, very non-responsive to all the information that's being kind of divulged. But when something was said, there was a moment of realization, and she looked to the right, and her eyes, she whale-eyed, and her head sort of jarred forward, a moment of, oh my God.
Yeah.
So I think she is learning these facts as we all are, and it's not making any sense to her either.
I mean, people are like, well, why did she admit it? Why did she admit it? Because her husband, who she still was married to at that time, said, oh yeah, you told me you did it. Well,
That's all
I'm
she
sorry,
could believe.
I would want a little bit more proof than that.
Right. I think that
And all of
she
us are
done
like,
what
oh,
she
they
was
were
told.
eating nuggets and broccoli, and they were on the couch, and Lindsay was walking around doing this and that. And I don't think any of that is real. I don't think we can rely on any information we have regarding anything outside the photos that afternoon. She was
agree.
having a great day. She was building snowmen with the babies.
yeah.
She's smiling. She's happy. Something happened in the afternoon.
I think you're 100% right. Is there any, when she came to, if she was innocent, why would she say, look, she only has them to
Asked
go
where
by.
her children were and asked what the visiting hours were so that her children could come in.
Right. I mean,
If
that's-
she had killed them,
she said what? She asked what the visiting hours were. Should she
Yep.
write that on the thing to see when they could come?
that
Oh,
was the first thing apparently that she asked after changing her medical POA.
And if you had unalived your babies, you wouldn't, when you speak to your husband on the phone the first time, or when it was 5 days later they spoke, when she
No,
could
I think
finally
we
actually.
didn't. And she spoke with the dry erase board 5 days later. From what I understand, he didn't actually speak to her until her birthday, almost 6 months later.
Oh, wow.
Right.
Yeah, because the parents talked him into calling because she was so depressed. But you guys, she only knew what people told her. So if she's got everybody telling her, you did this, you unalived, and you have no recollection of her,
And all that
of
came
this,
from
and you're
one
feeling
person.
crazy the whole time anyways, she didn't know. What did she do? She only knows what everybody was telling her. I think Reddington's letting her figure it out with the rest of us so that her reaction is genuine, so that we're seeing her realize, along with him building the big picture, that what she's realizing as we
Adam,
all
I don't
are.
know if you're trying to get a rise out of people or what you're quite what you're doing, but honestly.
Yeah, he's been doing that for like 3 days. We just ignore him. Just ignore him. And it is what
Sorry,
it
it's
is.
new to me.
Him and
I
Flower
You know,
Power.
I'm very willing if evidence is brought that
They
makes
did.
it extremely clear that shows the timeline is impossible, and evidence is brought that shows she does this, I will accept it.
Yeah.
At
Same.
this point, I see zero evidence other than something is very Chris Watts about this entire situation.
Absolutely.
Not because I want it to be, not at all, because it's devastating any which way. There's no winning here. I just want justice for the
And
children.
at the end of the day, we know that those 3 babies aren't coming back.
Right.
And
No.
and also, I mean,
And she'll never walk again.
terrible.
Don't they
There's no
deserve
winning
justice?
here.
Don't we
No,
want
there
to
is
see
no winning.
justice, y'all? I mean,
Yes.
everybody, don't we want to? All the people in the comments said whether you agree
But
with
if
us
you
or
add
not.
every little thing,
Yeah.
the camera's not working, the supposed timeline, why her Apple Watch was off, why he was the only person that heard her speak, when
Yeah, why
every
did he
other
switch off the
first
Wi-Fi?
responder,
Right.
when
I would
every
like
other
that.
first responder said she was completely incapable of speech, and yet she's
Also,
able
you
to tell
don't.
him the kids are in the basement, I killed the kids.
Yeah, and you don't need Wi-Fi to call 911.
And that after she had a brain injury, I don't think she spoke to him at all.
Nobody said. Every medical professional that she encountered said that she couldn't speak, but she spoke to him. It doesn't make sense, y'all. And look, things might change Wednesday. This is our opinion on when and a lot of us are medical professionals and are trying to make sense of this and putting this timeline together, but none of it math. Just
Doesn't
none
make
of
sense.
it.
The injuries don't math. The timeline doesn't math. KF23 has
His
asked
dad's an
here,
electrician.
how could he have done
Brother
it
or
if
uncle in
she
the
wasn't
police.
in the house? But I think he meant if he wasn't in the house. So for you, KF23, I think it's really important to keep an open mind. We have to question the entire timeline. If you're only basing your timeline on the fact that he said they were eating broccoli and nuggets and he left the house at this time, evidence has shown from the neighbor that the window was open in the bedroom before he left. And so it makes sense that they could have been rowing in the afternoon. The kids could have been sedated. She could have already been sedated. Who knows what happened? But she well and truly could have been out the window prior to him even leaving, which would explain
That's what
why her hypothermia was so significant.
Yeah. I think she was out in that snow for at least over an hour.
I
The
think
whole time he was doing
something
everything.
crossed the line that afternoon. Something
Yes.
changed, and let's face it, we've seen it before. Offing your kids and wife is a lot cheaper than a divorce.
Yeah.
It is. But we've seen the men will annihilate their families for a new and shinier thing. It's not like we haven't seen it, which is why I'm
I
having
also
such a hard
think
time.
it's
Why they
ego saving because
A
if
divorce
you
counts
listen
as a
to
failure for a certain
everybody
type
on
of
the
man.
stand, his family loved her. His siblings loved her. The nieces and nephews loved her. Her colleagues loved her. Her friends loved her. The teachers loved her. The people in the gym loved her. Imagine if he said, I'm leaving her with the 3 kids and one of them's a newborn, and I'm going to go hook up with this chick. Everyone would not love him. But if he changed the narrative that she was crazy and she did it
Yes,
and
banana.
he's free and they all still love him, it makes a whole lot of sense that his motivation to not just divorce her was way bigger than just the concept of like a moment of fury. His looks, if he was involved, his is the one that looks very premeditated.
I think they will. She should. And let's not forget about the almost $2 million. There's almost $2 million to play. They lived in just an average house, drove average cars. Now he's in a midtown penthouse, high rise in Manhattan with his doctor girlfriend. And he started the GoFundMe less than 72 hours after his family was annihilated, not to cover just the funeral expenses. I gave him a cool $60,000 because I know I buried a son and it cost me $20,000 for a very nice funeral. So I'm going to give him $60,000 for his 3 children. But $1.1 million, he needed $1.1 million and a GoFundMe. Then he sold the house, made another cool $700,000, and Lindsay's gotten zero.
How did
of
he
that
get
money.
all that money? Surely it
put
was
up
a shared
GoFundMe.
marital asset.
GoFundMe. He started a
GoFundMe.
No, I
GoFundMe
mean
72
the
hours.
money from the house sale.
He
How
did
didn't he get it?
because she's in the
Well,
hospital on
she's in hospital.
trial.
Yeah.
Yeah,
But surely that won't.
yeah. Her parents paid the
Whitney's
retainer
also
for the
asked in
attorney.
the comments. Whitney said, "Why wouldn't he make sure that she was already deceased if he did it?" I mean, he tried to cut her wrists. He tried to cut her throat. He's crushed her thyroid. He's dropped her out
Her
the
head
window
first out the
on her
window.
neck. He's heavily sedated her. I mean, I don't think anyone would consider. And he's left her in the snow, hypothermic. I just assume, you know,
Yeah, I
he
think he
did
thought she
everything
was
he
gone.
could.
I
Also,
think he was
don't forget,
surprised.
when you're sedated and when you're injured, your pulse goes right down. He could have just done, or
Thought she
whoever
was
did it,
gone.
could have just made a very cursory
Check.
fingers on the carotid or fingers on the
Only thing
wrist
was she
pulse.
had she was guttural breathing and she was guttural moaning in the 911 call.
Yeah,
Not-
yeah, and that's
So-
probably when he started panicking.
Yes. Yeah.
I think he thought she was gone at one point, and then when he came back at the end, it was found that she was not yet gone, and that she was still there. I honestly, I think I believe that, like you said, something probably happened, and this happened probably an hour to an
Something
hour and
crossed the
45
line
minutes.
that afternoon, and he thought, right now.
Yeah, and although there was no blood splatter on the sides of the walls of the baseboards, weird for somebody moving a bed, but there was on the side of the house. And if he dangled her out the window, that would explain how the blood got on the side
Like
of the house.
dead weight flopped her out the window because there was like she would have had to slap against the side of the house.
No, KF23, absolutely not. I'm an army medic, and I'll tell you what, your body's temperature, even with the spinal injury, just does not drop that fast. It doesn't drop that
Even
fast.
with the thyroid,
10, 15
it
minutes,
doesn't.
it
Right.
doesn't.
Yeah, and we've asked many medical professionals. We've had nurses, military medics up here, doctors. We've had all kinds of people. We've only had one nurse who came up earlier, and I'm not even sure if she was, that has said that this is possible. Nobody is coming up here giving us and saying, yeah, that could have happened. And hold on, let's get our board back out again in the
I saw that
14.5
22L.
minutes.
It's interesting.
It just
The
wasn't
theory
possible.
that he might have trapped her head in the window. It was a sash window.
There was
just
no
pulled it
injuries
along
to
her
her
neck.
neck outside the cut marks. That's the only thing.
No, there
We had
was.
we had the
thyroid.
internal injuries. We would expect to see some sort of external bruising, marking if there was a hard based, modality
KF,
of strangulation.
Even when your life has expired, you still do not lose temperature that rapidly.
No, you don't. You don't. I don't think you guys understand how low that actually is.
Yeah,
It
it's
just
20
does not.
something in Celsius. I mean, you guys use
Not if she was
Fahrenheit,
over
we use
medicated,
Celsius.
she said. That's what we spoke of
Celsius.
earlier. And we went over the med list and what she was all on. And we have nurses and medical professionals up here who are confirming.
It would have lowered it significantly, yes, the injury, but not that quickly.
And we got to remember, they didn't do an investigation. There was zero investigation because they just went along with, she said she did it. Here's all the evidence. I mean, he almost got away with it. I mean, thank God she survived, because now I think
There's a reason she survived, and I honestly think the reason is to get justice for those babies.
I agree. I think Reddington has figured this out. He wants us to watch her reactions in real time. He's going to show us that it was impossible that she did it, and he's going to show us exactly who did it. So she never said she did it. She just went along with what she was told. And because that's all she knew is what she was told. She has zero recollection of the event. So
yeah, and this timeline starting at 5:05 when he left, or whatever time they're saying the timeline began at, is we have to throw that out the window to try to understand her
I think there was
hypothermia. Much broader.
it all happened before the official record says it all
And
happened.
if he's as innocent as everybody thinks, then why did he get a retainer last week after the email thing came up?
Yeah.
Yeah. Why does he have an attorney in the courtroom on retainer? And now I wouldn't if I had zero to worry about. But I think he even sees that Reddington is piece by piece putting these little things out there, and I think we're gonna see him drop the bombs this week. I think that's what he's setting this all up for. Why else would he bring out the watch? Why else would he bring out the medications he sat up there on the stand? He's showing us that this simply could not have happened the way Patrick said it happened. And
No,
I also think
absolutely.
Reddington had very clearly stated this was from your laptop Pro. He didn't ask him, even though there was an upward inflection, he didn't ask him if this was from his laptop. He said this was from your laptop. And it was only then that Patrick kind of blew the times and was like, oh, I don't know, it could have been from my phone.
Right.
But,
Oh, I missed our psych nurse left. I think we've already explained it multiple times that when you're in psychosis, you're not going to methodically do things. You're going to do them, and what was the word that we use? I've been talking
Autonomic.
about, she's not
Autonomic.
going to methodically do things that are planned. We saw a good example of psychosis in Perez Hilton the other night. It just simply didn't happen that way.
Yeah, when you are in a state of psychosis, you cannot filter reasoning through that state, which
No.
is, the common phenomena of it. Is you can only
Methodology
really
goes
work
out of the
in an
window.
autonomic. You can only really work in an autonomic
Right.
pattern. So there's no filtering. There's no strategic planning. There's no, staging and setting up the room and. Even the concept of moving a bed to climb out a window, you don't care. I mean, Perez was using a bread knife, so
And
Doesn't make
again,
any sense.
her injury on her spine was not an impact break. It was from compaction. She was dropped on the top of her head, which is how she broke her back. She broke 5 ribs. They siphoned 300 milliliters of blood out of her lungs. She had brain fluid and spinal fluid coming out her nose.
How the hell
I
she
mean,
survived, I will never know.
by the grace of God. By the grace of God, she survived.
she had
And I
broken
think-
ribs puncturing her lungs. Yeah, she's going to have a chat about what she did. The 911 call, it was all guttural.
Yeah.
Breathing and groaning. She was fighting for her life. There's no conversations.
No.
And also imagine stating it as evidence. Imagine making the statement, he was like, what happened? And she's like, well, I tried to kill myself. And also the children are in the basement. I mean,
And
both
there's,
those are very convenient for him.
She
Yeah.
to go back to answer your question, and there was no, she did not brace for impact. And no matter what you're trying to do, if you're falling out of a 2-story building, which is only 15 feet again, she didn't even brace with her hands. There was nothing on her hands, no broken wrist, no scratched up hands from bracing for the fall. She was just dropped on the top of her head, and that's how she broke her back. She would have braced for impact no matter what had she jumped out that window.
I think she was unconscious.
Oh yeah, for sure.
I
When she
think
went
she
out
was
that
too.
window, I think she was
Yeah.
unconscious.
She was
And
floppy.
I would swear my
I think she
war
was the
days
whole
on that.
time. I think that's why
Yeah.
she doesn't remember anything, because she was just out the whole time. I mean, to have zero recollection of something, I think. And again,
That's
I
a
think
ridiculous take, KF.
They said they were from.
If God cares, he wouldn't have let the kids die. No, because we have free will. And whoever did that to those children did it of their
It
own
was a
free will.
choice. It was a choice.
And it's
They made a
it's
choice.
heartbreaking. And I can't talk about them too much because my voice will just.
I know it's a horrible case, but I think that I'm so glad that this attorney has taken the time to lay all this out so that we can see that the simple tale that he told the police, and they took it. Zero investigation, none. I mean, they just went with it. This is
Just
what she was told.
his word for it. I think the other thing that we need to really consider and just sit with all of us is the crime photos of the blood marks, because there was an extensive pool of blood under, on one section, and then the other side there was dripping, and it was in front of a mirror, which, in terms of evidence that would be suggestive she did it. The fact that she would sit on the bed, do it in front of a mirror, that aligns with S attempts.
Yeah.
So, I'm looking at all the evidence. I'm looking at every single thing. It looks to me as though she was lying on the floor. The pooling is non-movement pooling, just sitting there. They're
Right.
saying these are superficial cuts. They're saying they didn't. There was no main, artery
They're
cuts.
3
There was no.
millimeters deep. I mean, which is not a
Yeah.
scratch, you know.
Three
I mean,
centimeters.
Yeah, 3.5. I mean,
Centimeters.
I mean, you're talking about a pretty, not super deep, but it's enough. I mean, that's
Yeah.
not. She had extreme blood loss. I mean, again, they pumped 300 milliliters out of her lungs alone.
Yeah.
You know, from the ribs that punctured.
So I think about, what would it take if we had done that and we were sitting on carpet or lying on carpet or sitting on the bed. How do we just get one perfect pool of blood on one side and then dripping on the other? Are we looking at a stationary body? Is she moving?
Right.
There is definitely drip paths over the window.
Right. Which there would be if he was moving.
I wonder if there's any underneath the bed.
I
I'm
don't
curious
know.
about that.
I wonder if they even took, I mean, I do see on the timeline that we went over earlier that they were there until midday the next day taking pictures. And I'm hoping that Reddington is going to bring all that out this week. I think he's going to show us a lot more than we've been let see before this or even knew about. I
Well,
think
you
he's
obviously don't have the court documents, She Shed Gossip, because they did not correctly investigate him at all.
At all. They
interviewed
just
him,
took
that
his
was
word
it.
for it.
There was no
The entire
investigation at all.
timeline's based on his statement that the
He
kids were eating
said
broccoli
she
and
did
nuggets
it, and
when
they
he
all
left.
went, okay.
Yeah, that was it. And this is, and She Shed, we're not, this isn't anything that this is not the defense's information. This is not our information. We are going on the prosecution's, what they have put out, the information they have put out. So we're not even going with the other. We're using the prosecution's information. So everything that we're sharing here is not opinion. It's facts.
And this
The
is
prosecution-
also not a male
you don't,
versus
she
female
said.
debate. We're really
Okay, send
not.
them to me.
We're really
Yeah, send
not
them.
talking
I'd
about
love to see
whether
what you
men
have.
are better than women and mothers are better than dads. This has nothing to do with
No.
that. We are trying to understand.
Send me them. There you go,
what
She Shed
happened.
Gossip. Send me them.
Yeah. No, then send us the investigation that you have, because there's not one. They did not.
You're not
do one.
stating facts. You're stating, quite frankly, untruths.
Yeah, well, we'd love to see them though. No, I'm not going into your live. You can just send them over if you want to share them. If you have paperwork
Absolutely
that
not.
shows-
I'm not giving you any engagement.
Yeah, I'm not going over there either. I don't. I'm not going to. But again,
I think if
I'm happy
someone's
to
not
send
willing
it
to
and I'll
look at
correct
all the
myself.
evidence.
It's an open invitation. You send me the uncut so-called facts that you have. I want the entire page so that I can see where it's come from.
Yeah. We'd love to see it. So, I mean, you're here to talk about it. Share your information. We're sharing where we got ours from. We're giving you everything, and we're using the prosecution's documents here. So,
And
if
we're
you've
also
got something
talking
you-
about both sides of this story. We're saying there's a mirror there. Sometimes people, are known to look at their reflection when they're ending their life, which is also what we saw Perez Hilton doing. So we're not saying we're just going to pick a team. This is not picking sides. This
I'll
is
tell
not
you
saying it
I
wasn't the
went
dad, it
into
couldn't
all
be.
this,
Or...
Jane, completely believing that she did it. Completely
Well, I
believing
came
that
into
she
this
did
too.
it.
I thought it was an open and shut case because I work in this field, but against
I agree,
abuse and
Jen.
neglect.
We have professionals
And-
on the panel over here, not just people that like to get up and talk and make up things. I brought professional people that are in the field on my panel.
I'm not attacking
We're
you
using-
at all. You are doing the attacking, She Shed Gossip.
We're asking
And all
for your
I've said
documents.
to you is I think you are speaking untruths, and I would like you to send me this so-called evidence.
Thank you, Adam.
If you take that as an attack, that's on you.
Yeah, we're just asking where you got your evidence. We're showing where we got ours. So share with us where you got yours. We've shared with you. I'd be happy to send you what I have here.
No,
because
you're
we're
not
using
stating your opinion. Not when you're coming up with things like, "Oh, you're doing this and you're doing that," and you're no. Sorry, we're talking about this to me in a logical and compassionate way.
Right. And
We're not
and
saying that she's evil. We're not even saying that he's evil. So please don't try and flip the narrative and say we're all attacking you when we are truly not.
No, not at all. We're having a discussion here again. So if you have something that shows that they did an in-depth investigation, we'd love to see it
Yep.
because we're going off the prosecution's documents right now. They did interviews. There was not an in-depth investigation.
I don't think it's for me to say who is evil. I believe we will all get judged one day.
Yeah, we believe
I don't
that
think
we think that
unless
she
this was premeditated, we can't assume anything. Crimes of passion are real. Psychosis is real. You know, mental health issues are real. We can't assume this was evil unless it were premeditated.
Yeah.
And so that's why the
I mean,
important
I
thing
have
is
an
defense has
opinion,
got
but I
a
really don't think I've shared it here.
private investigator, and that will shed a lot of light.
I'm excited to hear what he has to say. I really am.
Absolutely, Jackie. I agree with you 100%.
Acting like you guys have a fucking law degree. Nobody's saying that at all. And you don't need to talk like that in here. So that's not the kind of conversation we're having. There's many other lives where you can go and be hostile and ugly to the panel or the people in the chat, but that's not what we're doing here. This is a true crime community, and we're talking about a true crime case, and we're giving our opinions. We're putting together a timeline that we don't agree with. And if you don't agree with it, that's fine. You can have a conversation, but you don't need to come in and just be ugly.
And I think it's really important that everybody is able to keep an open mind, because ultimately, can you imagine if she did not do this and she has lost her 3 children, has a broken back, has had her entire life shattered, and then she's locked up forever and people are yelling, you know, the electric chair. We had a famous case in Australia about the dingo that took the baby.
Yes.
Now, Lindy Chamberlain was jailed forever. They said there was blood in the car. They said
dingoes don't attack infants.
They said everything because they were concerned about the tourist industry. She went to jail. She lost her other baby that she was pregnant with.
Yeah.
She lost her husband. The entire world turned against her. They made movies about her. She was innocent. A dingo took her baby. They found the baby's remains 17 years later.
Yeah, with dingo DNA.
In a dingo den.
And you know what's crazy is that these people could sit on a jury and that they've come in with just, this is what they believe. They're not willing to look at any evidence. They're not willing to talk about anything and try to reconstruct. They just came in and
but you know what, Sads? We know it's not Australia. However, this was also another woman that was accused of killing a baby. So there are parallels. You cannot deny there are parallels. I don't care if it was on a different continent.
Nobody at this point of the trial, not one person in the panel, not one person in the chat should go, I definitively know it was her, it was him. We should be saying it could be either. Let's look at every single piece of evidence and be willing to not pick a side, but actually go, what happened to this family, and is the right person paying for this crime?
Exactly.
Prison princess.
That's what she said. And that's, I think, what we're doing here. Common human behavior, such as unalive a child, has nothing to do with not content. They're on it. Exactly. We're just talking, and we've been doing this all week, and we've been having a great discussion. Look, we've had quite a few people in here who don't agree with us, but we're having a conversation here. And if you've got evidence that you think that we need to see, because we're spreading misinformation, we're willing to look at it, but you need to send it so that we can understand where you're coming from and what you're talking about. Everything that we're talking about here is right here on this screen, and it's the prosecution's paperwork that they put out.
Yes, Cherry, I saw that.
So Sads has mentioned that, you know, it couldn't be him because he was caught on camera. But Sads, you're assuming the timeline that he stipulated is accurate. We don't know what the true timeline was. We can't actually go off. We can't go off the fact that, you know, it was when he left the house to when he returned, because we truly don't know what was happening prior to him leaving now, because we really can't trust that they were sitting eating nuggets and she was happily walking around the house. And we do have evidence to say the timeline of her injuries don't match to the children's injuries in terms of bringing the children back, if they'd all been done at the same time, or if she had unalived them before herself, but her body temperature is that low, but they could still bring the children back. Both both sides of that don't make sense. Her
Exactly.
body temperature was too low to
Correct.
have killed them first and to be able to get a children's heartbeat back.
I
So
don't
it's
think the
quite
baby was ever
clear.
really gone. I think he was in the same state
Yes,
that the watch
Ash.
girls were in, that he was just probably brain dead and barely hanging on. And again,
Yes.
that body temperature is when she got to the hospital after they had been warming her for
Uh-huh.
approximately
The ambulance was
9 to
heated.
11 minutes. I'm going to say her body temperature upon arrival was probably about 78 or 79 because they already had the 9 to 11 minutes and the warmer, which they do very slowly. There's absolutely no way. And we've had all kinds of medical professionals up here that you can, unless it's just some miraculous that we'll figure out one day and it'll be on
But not
TV
by
as a
that
medical
much,
mystery.
Adam.
It didn't happen.
I
She
don't
didn't.
think it's possible that the children, even one of them, could have got a heartbeat back if she had unalived them first, simply based on the fact that the time that it took for her body temperature to drop that low. And yes, we talk about injury and thyroid and all that stuff can change body temperature. My daughter had a tumor, cancer, when she was a baby, from T1 to T10,
I don't
crushing
think
her
it was
spinal
snowing,
cord.
Adam.
Now, she had dysregulated body temperature. She would move within a range because of that spinal cord injury from T1 to T10. She would move within a range, and this is normal on the ward where other children had spinal cord injuries, where we were, that she would move around 5, degrees.
Was it that much?
tops.
5 degrees? I know it's
Yeah.
at normal within a couple of degrees on any kind of variation on any kind of,
Yeah.
any given day, but it can go up
But
to
not
5.
what we're seeing here. She is severely hypothermic, suggesting the timeline for being able to bring a baby back versus how hypothermic she is, even with spinal injuries, even with thyroid injuries. I don't believe the children were gone before her.
Yeah.
I believe she was
she's been
out there
for an hour
freezing
and a half.
for a long time prior to the children.
And even being in the snow for an hour and a half and getting her body temperature, that's even a reach. I mean, it's very, very difficult to get a body temperature in a live person down to the 70s. It just doesn't happen. And
how
even
was there
54.
time? Yeah, I agree. I don't mean to interrupt. I think we're all
Oh, no,
pretty
you're fine.
passionate here. How was
We
there
all are.
time to sedate the babies, so to medicate them, have it in their circulatory system, having been absorbed, having gone into the tummy, been absorbed in their circulatory system, and then she's unalive them, having given them time to process this medication after he leaves, and then she has time to hurt herself and be outside the window and freezing to that point. It does not line up.
Right.
Yikes, sorry if you heard that.
Gosh, thank you for the Cupid's bow.
Oh wow, thank you very much.
That was very cute and lovely. Thanks.
Thank you. I could do with a
So-
Cupid's bow.
Sad. I have to check on that as well. I didn't know that they had found, and I believe her. I mean, these are nurses and medical professionals up on the panel here. I'll have to go and see. I'm going to look on the prosecution's document.
Yeah, let us
and see
know.
what the levels were. You're probably right. I just didn't read it.
Yeah,
I
I'm happy
thought
to
I
be
read
corrected.
that one of them did. But I attributed that to breastfeeding, but then I read that she wasn't breastfeeding
She's not breastfeeding,
anymore.
no.
So, because it was the baby that I believe that I read that they found some of the medication in the system, but I'm going to double check that because again, we don't want to tell. It does us no good to tell you guys lies here. We're going by court documents here. We're
Yeah,
having
because
It's
I
gotta
didn't
be
know
in the
that
evidence.
Callan had anything in his system.
And medical
I saw that.
experience and medical instance as well. Like I said, I'm an ex-army medic and a nurse, and so I saw a lot of very, very fresh trauma. I was
Yeah,
quite
and
often,
Colin, did
one
you
of the
say that
first
the baby had-
people. Pardon?
No, I said, Jen, I didn't know that Callan had anything in his system, but I came up here to kind of get your guys' perspective on so many people accusing Patrick.
Mhm.
Like,
Yeah.
why? Are you guys thinking that's a possibility, or is that conspiracy
Yeah, I think
street?
it's a possibility. Absolutely.
I went into
At this stage,
completely
anything's a
thinking
possibility.
It was cut and dried, and I honestly thought it's so sad, you know, postpartum psychosis. That poor mother, those poor children. And then I saw other facts surrounding the case, and as soon as he got on that stand, something was screaming at me in my gut.
Yeah, and to do more
I'm very
Yeah,
suspicious.
okay, that's not a fact.
I have always said your mind may not remember, but your body
Be right back.
never
Yes.
forgets.
I
And-
was married to a narcissist, and I'll tell you what, once you see it once,
You can't unsee it.
you can't
Well,
unsee
what
it. And
about,
I
like-
literally got chills.
What about when the prosecution was saying that he had looked what he looked up about Esticide, and the defense attorney was trying to say that he accidentally clicked on a Wikipedia link? Like, I pulled
Tom
up
Hill.
that Wikipedia. Like, there's
Tom Hill.
nothing
Was it
on
Tom
that
Hill?
page
Tom Hill.
about
Did you look,
Esticide.
Solon? Did you
Yeah,
look
I
and see
looked.
there wasn't?
Yeah, of course,
And
it's
for
years
those of you who
ago,
don't know
but-
Solon, she's a great creator. She does a lot of investigating. I'm happy to have her up here. She's open to good conversation.
But I don't think
That's
the
interesting,
defense-
Sullen. I thought it was in the evidence that I thought the defense brought up a piece of paper and it showed that he had gone onto the Wikipedia page to look at this
country
Tom
music
fellow,
in there.
Well,
and then
Kevin didn't
it
do-
showed that he clicked a hyperlink. Is that not in evidence?
That's what Kevin put on the screen, but we couldn't see it. Like, he wasn't very good at putting it on the screen where you could see
Yes,
the
okay,
document.
But the
Right.
prosecution wouldn't let him just put willy-nilly bullshit up there either. You know
Let
what I
me
mean?
look. I've got the prosecution's. Sorry, y'all. I've got the prosecution's. All their documents right here. So let me take a look and see.
Look at that.
Is it? I think it's 71. I
Guys,
think
can we all talk at one time, please?
Yeah, take turns because we're losing everybody in the chat.
Can I just hi everyone. I've been desperately feeling so alone, and I want to say
Another
thank you so
break.
much, Cajun. I know, Katie. I can't believe I found you. It's actually hit in UK London, and I just want to say a perspective that I think is going to be really interesting to American audiences. First of all, the first thing I was thinking, because I am a mum, I think it does matter if you are a mum. We are all, I don't know why, for the first time I felt, I don't know about you girls, and you don't have to be a mum, but anyone who is a mum or who cares for children, all of us are invested because it's the first time it took, sadly, the unaliving of 3 innocent children to have a proper, decent, honest conversation of what's happening behind private closed doors to women
Yeah.
stressed by motherhood. That's one. Second, I was going to say this. What a lot of people, because I see people coming, and I've seen a lot of men who are quite toxic saying, oh, all the women on the
Right.
internet, they
Man
think they're all
haters.
Sherlocks, they're all sleuths suddenly overnight, they think they're, detectives. What they don't realize is one of the biggest cases in the UK of a nurse, and Katie will know, Lucy Letby.
Yeah.
Do you know about this, Cajun? Lucy Letby? She's a nurse
I know about
who was
that case.
being sent to prison for the unaliving of 7 babies who were in a premature unit.
Oh,
But do you
yeah,
know
I
what's
remember about
interesting? The evidence is unpacking now, and I believe it's not long before she is eventually set free, because I took the decision. Because what I always do is I don't follow sensationalism. I go straight and I think of the children or the victims of crime. And then I start looking at the evidence.
Right.
And what makes me so shocked, having been a victim of serious crime myself, having been myself at the hands of a violent man with whom I had a baby and is currently walking free in Switzerland, the rule of law, of course we should all respect it, but the rule of law is only available to those with the deepest, richest pockets.
Right.
And this idea that somehow everything went, absolutely hunky-dory from day dot is ridiculous. And I'm just
Right.
going to say, Sullen, was it you, Sullen, who was saying, why do some of you have concerns? I'm not saying Patrick is guilty. However, I need to be fully convinced that somebody should go to prison, because I do believe innocent until proven guilty. Now, she has admitted that she did do it. But here's the thing. Why is it the whole internet has gone agog, because here's the thing. Let's go back to the email. So, Cajun, let us know when you come back to that link. But can I just
got
focus on the email of 5:24 p.m.? Actually, I'll go quiet while you tell us that, and I'll come back to the 5:24
Are
p.m.
you sure?
email. Yeah, please.
Okay. So what I've got here, Solon, is at the trial, Lindsay Clancy's lawyer, Kevin Paddington, also referred to as Patrick Clancy, about the Google search he made in December. The search was for the death of country music singer Tom T. Hall, who had committed suicide. The cross-examination. So it looks like the search date was in December of 22. He did search for the Tom Hall's death. And briefly explain method of suicide. It's here. Paddington's question was not directly about suicide, but he asked for if there was a helpline. He clicked on the helpline link and the response and what the response time. I'm sorry, what? Okay, and what the response time of the
That's even more sus, though.
Yeah.
Like, that's even
Correct.
more sus
You
to
know,
me.
Correct.
so and what we did earlier this morning is we put together this timeline, because as medical professionals, we've got a lot of them here on the panel, this whole body temperature and the crushed thyroid, and it's what has got us all kind of going, wait a minute, that doesn't make sense. So we did the timeline, and I've got it all written here, but there's just no possible well, of course, there's always a way, but the odds are that her body temperature were about 78, 79 when they found her in that snow. It would minimum have to take about an hour to an hour and 45 minutes to drop anywhere near that range. We think, according to Patrick and his bad timeline, that this probably happened a lot earlier, and that this trip to the store and everything was probably, just a cover, and that he had probably been medicating her for quite some time and, destabilizing her medication, and that's probably what happened this day. It looks like.
I'm wondering if they have any people that received the phone calls from the mother. As Patrick said, she had called and ordered the food. She had rung the chemist about if they had the Pedilax, which makes no sense. If she
Why
rang the
would she
chemist
do
to
that?
where's the
inquire,
call?
why
Yeah.
did she
Would you do that?
inquire? And then why, when she did inquire and sent him there to get it, did he say they didn't have the name brand? But we see that he actually got the name brand anyway. That timeline also, that evidence doesn't match.
And would you call CVS, like, we're all mothers here, and ask if you have
No.
Miralax? No, you'd be like,
No.
take your ass up to CVS and grab some Miralax. If they don't have that, grab whatever's next to it. Like,
grab the
nobody,
generic.
that sounds like he's setting up a timeline to me. That, like he's making sure that he's got all this on record so he can show, oh, I called her, and then she called me back right in the middle of slaughtering my family. She called me back and talked to me for 14 minutes. And then 15 and a half minutes later, I found her in the snow with a body temperature of 79 degrees.
I've just
Around
looked it up, and that body temperature in Celsius is 25, which is
Very
a corpse does not cool that rapidly.
And I couldn't write it on the one side, but Solon, bear with me, because I'm not a pro like you guys are with making all this stuff, and I couldn't write on the other side.
Hardly.
But, you guys are so good at this, and here I am just trying to make it through life. But after we did everything, we had 34.5 minutes. We gave him 12 minutes, gave her 12 minutes, 4 minutes a kid. That took us down to 22 minutes. Then we gave another 6 minutes because she cut her wrist, her neck, everything else. We moved. We had at the end, after the phone call, we had around 15 minutes for her to end up in the snow and her body temperature to drop to 82 degrees. Which simply cannot.
Well, it's also weird that he stayed with her for so long and didn't immediately go look for the children, and then he just happens to find them while EMS is there, right?
Right. And she
Like,
told
that's
him. Now remember,
weird.
he also states that she said, I did this and the kids are in the basement, but every other medical professional, and it's on the defense's paperwork here, never got a word out of her because it simply wouldn't have happened. I mean, with the injuries that she had, she could not speak. She was writing on a dry erase board 6 days later when she came out of the induced coma. So how was she so
She able to talk to him? Yes.
How was she
And
able
he'll
to
lie
give
about
only
that. He'll lie about everything.
two key pieces of evidence? I tried to commit suicide, and the children are in the basement where they were found.
And then that's
Why
it.
only those pieces of information were her two statements? It
Yeah.
doesn't make sense when we know she couldn't speak.
Exactly. And that's what they went with. And then, so that's all she was told. So people keep saying, well, she admitted it. First of all, you have to remember this woman,
Yeah.
we gave the medical timeline of the medications here. And for those of you who missed it, I don't have to redo it again, but it's pretty mind blowing, the medications that she had within the 74 days. And most of them were within a 6-day timeline. So, I mean, I had a psych nurse on here. I think she got off, but she also said that was just, it was over medicating. There's no way that she could have been functioning with those medications.
Absolutely.
Listen, also, one really important factor is that she documented every time she changed medications as per the doctor's instructions. She gave the previous medication to Patrick. He kept them in a bag in his car. Now, they found Seroquel, which she had been weaned off since the 5th and had given to him for the car to take to the fire station to be disposed of appropriately. How is Seroquel in her system if she doesn't have access to the medication she no longer takes?
There was 4 medications in her panel
guys
that
got
day
the
at the
results?
ER that were DC'd 3 weeks earlier, which means discontinued.
Yeah, I was waiting for the blood test results. I kind of fell off the case when all the prison calls came out for
I know, those
Gypsy.
are crazy too. I can see why.
But I heard Friday was a really good day in court, so I may
Right.
stream that tonight.
I think this week is, I would really like to see you watch this, Sullen. You're really good and you're like open to, things. So I'd love to see you watch this week and give your viewpoint or even come back up. Cause look, we're all open here. Like if we're missing something, like we were telling She-Shed, let us see it. We don't want to put out false information. That's why everything I'm putting out is the prosecution, not the defense, not me. We're going to just go by the prosecutions, who we obviously don't agree with, but this is their evidence and their paperwork that we're going to talk about. And it still just doesn't add up. It just doesn't.
Even if we consider the fact that she had a significant mental health crisis, she was in an intense and a declining mental health crisis. I'm willing to sit with that, and there's a high possibility she could have gone into psychosis. I'm not dismissing that could be the case, but it's the evidence around it that is confusing me.
Yes.
Yeah.
I think I wanted to go back to some of the evidence that I've been looking at, and I was wondering if people could help me as well when I talk about the concerns I have. I want to go back to the 5:24 p.m. email.
Right.
Now, that testimony that was provided by Patrick when Reddington, who's very smart in that he presented him with an email and he made him read out the date and the time.
Right.
But
There's a
this
reason.
is just one of many stumbling blocks that I have, because I didn't know anything about this story. I was to all intents and purposes, I was thinking, oh my God, what a vile mother. You know what? She definitely did this. She needs to, whatever.
Right.
However,
Same.
as I started to unpack it back to that 5:24 email,
Something's wrong.
I remember the day that my father passed away abruptly, okay? I remember every minute of that day, 23rd of March 2004, when Reddington presents him with the email and he asks him, can you say the date and the time? The question arises where Reddington says, oh, it was from your Surface Pro. And then he says, oh, maybe it was from the iPhone, okay? Now, if it's from the laptop and then he said there was no Wi-Fi or something, that's one of the red flags I have. Okay. Why would
Well,
you
there's
not
a really
know?
quick solution for that, Yasmin, because every single email that is been sent
Have
from a
metadata.
mobile phone, it will say at the bottom of the email that it was sent from a phone.
No,
So
no, no.
that
You
will
can
be
actually
in-
turn that off. You can
Actually,
turn
you
that
can
off.
turn-
I've
yeah,
turned
yeah.
it on
You
mine.
can- yeah, yeah.
It's just
You-
the
They can
signature
still
block.
tell though.
Yeah, yeah.
Reddington knows where it was sent
The
from. We made
metadata,
sure that
you
he
can
knew
bet
he
your
knew where it was
bottom
sent.
dollar that Reddington has had somebody in
Yes.
data analysis
Yes.
look
Yes.
at it all
And he
and
knows.
look at the metadata.
And I think he knows it was sent by iPhone. But the second thing is, I'm just sharing with you and tell me what, you girls think, okay? And of course the gentleman, the fact that some of the DNA was scraped from the wall months later makes it to me
Yes, it's degraded.
extremely concerning.
Right.
Third, the news is broke. I don't know if this is true, that he was apparently looking for apartment in New York several years, or at least before.
before
He
or
had,
within the
yeah.
year. I
So
didn't
that's another
hear
new
that.
thing. Do you see? It's
Yeah.
like every time there's a twist and turn, there's something new. Just as I'm
Right.
absorbing, and for me to believe that Patrick is 100% innocent and she needs to go to jail is for me not to be confronted with such red flags. But the other thing is his reference to the children when he speaks on 999.
The
What is the
fucking
phrase he
kids.
used? What was that
He
phrase he
killed
used?
my
The
fucking
fucking
kids.
Yeah.
Yeah.
Or
Yes.
the kids. And then something about Dawson being a light sleeper. Then I'm just going to share what else I've been going and digging is a lot of people have been going, which I think is a bit too far, going and looking at the reviews of his new wife. And apparently she's not had very, because she's infertility, I think.
She's an
Yeah,
infertility
she has
specialist
infertility.
and
Yeah,
an
fertility endocrinologist.
endocrinologist.
Yes, and apparently there's a few bad reviews
Right.
about her as a doctor. So I thought, okay, but I think that might be going a bit too far. And finally, ladies and gentlemen, I have seen that Reddington's daughter is on TikTok. Now, have you seen? Her
No, I
name is
But I'd like
yeah, you can always rely on me. I go down such a rabbit hole. I'm going to be one of yours, like bringing home
I
the
love that about
unknown
you,
tokens.
Jasmine.
Yeah. So
Instant follow.
she is
Yeah,
on
so it's on
TikTok,
case.
and she has actually, though, because people are saying, "Oh, we love your dad. Oh, he's so amazing. He's got a secret plan, hasn't he? It's Patrick." And do you know what? Interestingly, she's like, "No, that's not happening."
But then
Oh,
she
well,
wouldn't say.
But they even wrote that. Somebody
didn't
wrote it. Yeah, but
comment
we know
on
it's
it?
secret.
Wouldn't say.
We know you
It's
can't
an
say
ongoing
anything.
case. She can't say
True,
anything.
true. She's an
Right.
attorney herself, but
Yeah,
her
both
response
of
has
his
been, no,
kids
that's
are.
not the case.
Well,
Can
know,
I
I
just
think
go
it's
back?
in my tuppence.
Can I just go back to something very interesting that Rachel has put in the comments? Rachel has said the psych on the stand said Patrick said she only wanted meds because her friends were on them.
Yeah,
She-
very
actually, she
interesting.
didn't want the meds.
Absolutely
I have the prosecution
most
paperwork right here where she
dismissive.
denied meds and only wanted therapy at first because she did not want to use
But
medications at
how
first. So
dismissive of Patrick. Oh,
Yes.
yeah, her friends
so
are
cool
on
to
them,
be on
so she
benzos
wants
and
them too.
antipsychotics.
Oh, yeah, her friends are at school and they're smoking behind the bike sheds, and so Lindsay's going to want to smoke too. I mean,
Right.
if that isn't the most patriarchal,
Yes.
dismissive
Yeah.
piece
And
of...
again, yesterday we
evidence.
had two members of the running club that the new wife and him are in, and the other one was on a different live. She said that it was common knowledge that they had been canoodling for quite some time. That this was
I
not,
don't
and that
doubt
all the
it.
friends went with them after he
Oh,
divorced
wow.
Lindsay because they all knew that they were part of the same running club. They ran the Boston Marathon together. They had been doing this for quite some time, and it was common knowledge. So, and I think Reddington's going to put that out this week. There's no way that he couldn't. I think he's just setting up for this week. And we watched him drop all these little breadcrumbs.
But I
all these-
honestly don't think his
Right.
daughter's too clever to say anything, even to
Well,
drop
she
it in.
can't. She can't be divulging anything about the case.
Exactly.
That would actually damage the case. So she can't say anything.
Yeah.
I think we do also all need to brace ourselves that, perhaps Reddington doesn't have, an intention of blaming Patrick. That his main objective is
But he's
to
already sown enough
is to
seeds of doubt.
put in question whether she did it or not.
And
Um,
then we'll have to get up here and say, guys, we
Yeah.
were wrong. Like here
Yeah.
it is. Here's the real information. But again, this is a true crime community, and this is what we do is talk about true crime. And honestly, I'd be shocked if we were wrong. I need them to make
Yeah.
sense of this for me because it doesn't
Yes.
make sense unless it's what we have been talking about. It's the only way I can get this to make sense. And I had her convicted last week. I was like, oh, we got another Andrea Yates here, And,
I did too. I
Kate-
wasn't thinking
too.
she was evil or
I just
wicked.
thought it
You
was
were
a
here.
I
absolute
felt sad.
tragedy.
I wanted to know how she had slipped through the gaps in spite of her numerous attempts to get help. So I
Right.
came into this absolutely open and shut case of postnatal psychosis because she slipped through the gaps, and I wanted to
And
understand
He
where
most
it was
definitely
missed.
did. I mean, we
Yeah,
went
me
through the
too. I
list, and I'm going
figured
to
it
go
was a slam dunk NGRI, but then as it
right.
keeps going, you just keep going
Yeah.
back and forth. So
Yeah.
is it true that there was Lindsay's DNA was not on the exercise bands?
It
Only
was on
Patrick's?
one from what
One.
I read, and I'll look it up to make sure. And I'll send you the stuff, Solon, if you want me to.
Yeah,
From
you
what
can
I'm
email it over.
reading, it was on one of the bands, not all of them. But
Okay.
she bought the bands, so if let's say they were wrapped up, and she grabbed the box to buy them, it would be on one of the bands. From what I,
Well,
you know,
why
I
is
don't.
it
I,
not
I
on all
also don't
three?
think a part of the evidence was that it's very hard with elastic bands to get prints because they expand and they shrink, and so I'm not even putting a lot of credence into the bands because the kids
well,
could
her
have played with
DNA,
them.
though,
Both
being
of them
on
could
it.
have used them. I don't know that the bands and prints and DNA evidence on the bands means
Well,
anything.
they were
There
new.
is so
So if his
yeah.
DNA was on them
They're
and if hers was
new.
only
That
on one and tying them and maneuvering, I mean, you're going to get your DNA on. And again, I'm not hanging on to that as much as I am the whole big picture that we put
yeah.
together that, and so on, take a look at it and go over the timeline. I'll even message you some stuff. It just, we can't make it fit, and if he'll lie about one thing, why would he lie about that and start it off? Then it seemed, one lie covers another lie and another lie, another lie, so I feel like
because Cajun, I've come across the most critical narcissistic liars, but what happens is they're quite comfortable in that little zone that they have. It's that, what is it Shakespeare said, oh, what a web we weave when first we
Tangled
practice,
web we weave
when first we practice to deceive. Okay,
Yes.
because you can hold on to a few truths, but it starts unfurling. So I want to also talk about the GoFundMe, okay, which has been
talk about
paused.
GoFundMe.
It's paused at the moment, which I don't know if anyone knows, but I don't know if that's because of longevity, if it's been 2 years. Because I saw recently,
I think it was shut down at $1.1 million.
It raised,
and again,
yeah,
he
it raised
set that up 72 hours after his
Yeah.
children were unalive to help with
Yeah.
funeral expenses. Again, I have had a funeral for a child, and it was an expensive one, and it ran us about $20,000. So I'm going to give him 60. So let's give him 75 to bury
Yeah.
his kids. Why did he need $1.1 million? How obtuse
Also,
of
But
him
he
to
said
do
he
that.
said
I
he was
don't
going
know
to
any
use it for
funeral
legal
directors.
One at a time. I can't hear it. I can't.
Oh,
That's
sorry.
a
It's okay.
fucking money if you want to put in perspective, like
a
a million.
funeral
Like, holy
director
shit.
at that
Right.
time with a multiple tragedy of children, I can't think of any. I mean, my son-in-law is a funeral director, and I know for a fact that if it's a multiple tragedy, you're not paying the same amount as you would.
Right.
For
I'm just giving him the benefit of the doubt that it cost
individuals.
$75,000 to bury
I
his
just think,
children.
yeah, I mean, I think the fact that within 72 hours or whatever he was sitting down and setting up a GoFundMe,
Yeah.
I would have
How
been in the
obtuse.
corner, a blubbering,
Right.
incoherent.
Yeah.
I think when it comes to GoFundMe's as well, someone set one up for me and my family when my daughter was diagnosed with cancer, and they set up like a goal of like 5,000 just to sort of support us, and what people gave they had no control over.
Right.
So sometimes GoFundMe's go way over.
Well, you can cap
but what I
them. Like you can put a limit on them, and then
Yeah.
you can extend the limit as well. But why wouldn't he have stopped it at
Yeah.
I don't know $100,000 instead of this
Yes.
big money grab?
Well, he
Yeah,
needed to buy a nice mid-rise in Manhattan, didn't he?
Yeah,
Yes,
take a
he
look
did.
at the house him and Lindsay lived in, and now go look at the mid-rise he lives in Manhattan.
Yes. I was somebody released another TikTok video of going past the house, but he also, I believe, said he would use it potentially. I could be wrong, for legal fees. Okay, but this is what my question is, and I really wanted to find out how the American legal system works, because clearly people are saying that the parents are using their life savings
They
to pay
did.
rent
They
and
cashed in
tax.
their pension. He
Yeah.
has not paid one dime of
Yeah.
her defense. They
And,
cashed in their
and that's-
pension and sold their home.
And that's what's upset me. But secondly, I found out that because obviously the other thing, coming back to Lucy Letby, the nurse, and why people are saying she's innocent, is because in the aftermath of being arrested, her family are just middle class. They're not rich. Often it's the legal advice you get, and I wonder, is there a case where in 2023, there was so much pressure because don't forget also that when there's 3 children, from a public perspective, public relations perspective, it's down to your DA, whatever, to quickly indict, get that person, put them in jail. Did she get the correct legal support? And I come back like you.
She's still
I'm
going
not here.
through
Yeah,
it.
I'm not here to support. I'm not one of those people like, oh, free Lindsay. I'm thinking about those 3 children. There's only 3 people who need justice. It's those 3 children, and I need the right person to go to prison. I
Agreed.
want the right person to go to prison. So, is there a case that even though she's admitted her guilt, if there's new evidence that is so strong, is there anyone in here with the legal expertise in the American judiciary to tell us if that can be unrolled, or can there be a new trial, or could they go after Patrick?
Well, that's
if
where
there's
we're
enough-
at now. She
Yeah.
has not been convicted, so we're at that point now where we will find out if we believe that she's guilty or innocent, and that's what we're in the middle of.
But
She
she's
has
already
been-
said she did.
Well,
This is when
she
No?
did what she was told she did.
Yeah.
Again, you know, she's repeating what she was told. She has zero memory of it. She thinks she was going crazy. Let's go over the med list one more time. Sullen, I think I don't know if you've seen this, but we did this when I first came on, and this is why I came back this evening, because I got cut off
Hey,
earlier.
Jen, love you. I have to hop down.
Okay, I'll call you later.
Okay,
Bye.
bye.
Thank you.
Hey, Terry.
In mid-October, they started. Now, this is in the 2-month time span. She was put on Zoloft. The next day, they added Ativan. On November 16th, they added Trazodone. On November 21st, Prozac, 10 grams Ambien, Remeron, and Klonopin in the same visit. Now, are you writing these down? So in 9 days, they gave her Zoloft, Ativan, Benadryl for sleep, Trazodone for sleep, up to 150 milligrams. On 4 days later, they added Prozac, 10 milligrams, Ambien, Remeron, Klonopin. Now, 1 day later, they upped the dose of Remeron and Klonopin.
Gold, please stop spamming.
4 days later, just ignore them. 4 days later, they added Seroquel at 400 milligrams a day. A week later, they added Valium. 7 days later, Lacimadol, which is a mood stabilizer. Then on January 3rd, they added a stronger dose of Trazodone, Valium, and amitriptyline. That is 14 medications in 67 days.
Yeah,
And
I've
now-
seen the
Hi.
CBS report, but I also didn't understand like why they were weaning her off the Valium if her biggest complaint was the anxiety. And I understand like, you know, when you first start taking medications and you're going through your mental health, they do interchange things. So it's like that's why the blood test was so important to me, like what was in her system.
Right.
Well,
So,
Sullivan,
and
they
now
said in
the blood
evidence-
test that they did, hold on 1 second, Yasmin. What they did the panel the day of the Schmurders, they found 4 medications in her panel that were DC'd 3 weeks earlier. So that means discontinued. So, and these drugs were supposed to be in his truck on their way or at the fire station, but he never dropped them off. But we find a pill crusher and 4 medications in her system that were DC'd 3 weeks earlier that would not have shown up in her system had she been off of them. We're talking 72 hours, maybe another 24. You know, if she's a long-term user of it, then you'll still
What
find it
meds?
for 3 weeks.
Which for?
I'll have to look them up. Let me. find that.
pill
Sorry, I'm
crusher.
going like through all the pages here. So
Sorry,
And
can
again-
I just ask a question? Sorry,
this is
hi.
all the prosecution's paperwork. So this is not the defense. And I thought that was the fairest way that I could share the information. Nothing that we're sharing here today is opinion other than timelines. Everything else is
Yeah.
the Seroquel, I think they lowered the dose, Lori, if I remember. Benzos, let's look that up because I'm going to say you're wrong. How long do benzos?
What was this all prescribed by one professional, one doctor? Or was
These
it
were 2 different doctors.
So they weren't.
1
corresponding
to
with
2
each other.
days. So I thank you.
Yeah.
I give it 72 hours. They do not
So
stay
these-
in the system long term.
These 2 doctors.
Yeah,
were
it
not
can be up to
correspond-
30 days if she's long term.
Yeah,
So these
yeah,
two
and
do-
that's not blood.
Sorry.
So-
So these 2 doctors weren't corresponding with each other and telling each other this is what the lady's having. There was no
They
There's
should be.
not.
So I own a home health care agency. So anytime you go in the doctor or the hospital, we have an EMR system that we can put your information in and we can look up your history. So let's say you went to another doctor or something and you came and saw me tomorrow. I'd put in your information and I can see your history through the EMR. We're all connected. Kind of back to the Gypsy Rose thing, Sol, and how they're like, oh, they couldn't find my records. Yeah, they could, because
Yeah,
we
they
all
could.
work off an EMR system. So, you know, that they would have seen and probably said, and that's why the other doctor here was like, oh, they just put you on this 2 days ago. It's not working. Well, we'll just up the dose. And that's what it looks like they were doing here, was they were bouncing off of each other's prescriptions, but adjusting them accordingly. But they didn't give it the time. And this is a woman who never took medication. You throw these kind of medications at somebody, and I'm not sure how she was upright, to be honest with you. It's just too much.
It sounds like a lot of medications for
It
her
is.
to be on, to be quite honest.
Oh, it's an
And
enormous
Get my
amount.
cat. I'm so sorry.
Especially all those benzos and
Yeah.
the high dose of Seroquel. Like,
Right.
you don't
Yeah,
take
I mean-
high doses of Seroquel to go to sleep.
We've got Valium, Trazodone. These are just the benzos that she had access to. Valium, Trazodone, Ambien, Ramarin, Klonopin, Trazodone. Again, I've said this earlier. We call those psych ward sleepers, and that's because you can knock people out and do rounds and not wake up everybody at nighttime. You know what I mean? And keep you so you're going to sleep deep. These are very heavy
Do
medications.
we have
Very
do we have the timeline for each medication? Because I know
Yes.
they were changing them out. So where did
Um,
we see each drop out?
So now she refilled these all for these 3 months. So if they did pull them back, she still refilled them. So I don't know how either Patrick was giving them to her or how she
Yeah.
was taking them. But from what I understand, through her journal and Patrick, he was handling the medications. That's just what's in here. So starting mid-October, look, on an average of every 5 to 9 days, they were adding more or doubling the doses. So, and this is, oh shit, hold on a minute. So here it is right here. These are the dates. So you can see starting mid-October to mid-January, they're adding more and more or doubling the dose up to every 9 days.
How on earth
Can I
was
ask
she
you, in America,
functioning?
in America, because I know when I had my daughter, and she was premature, and I think they put me on medication, and it was just one, but in 13 or that amount of medication, would that not require her, if there's any health experts of America here, would that not require an automatic overnight facility?
I
Or
would
is she
think,
just
and our friend, the psych nurse who was here earlier, we both agreed that on these kind of medications and the amount, we wish they would have kept her inpatient to get that, that baseline on her. This is a lot. This is a lot of medication for somebody who's never been on them before. I mean, one of these, what are they called? Me and Justin were talking about it the other day. The Klonopin, the amount of Klonopin that she was taking alone. If I took one, you wouldn't see me till midday.
Yeah,
tomorrow.
Klonopin is hardcore benzo. Like, you're not going to remember nothing. You're not going to know where you're at. Like, it's strong.
Very strong.
Why was the husband handling that medication? Is there any particular reason why?
I haven't seen anything yet, but I was going to read more of the journal tonight that they released, but for some reason he was handling it. But she's a nurse, and a lot of these are build-up
That's what I'm
medications.
thinking.
They build up in your system over time. So
With
why he was
half-lives,
crushing them, it blows my mind. Or what, I can't imagine that Lindsay was allowing him to crush these medications and give them to her. I think he was doing it to over medicate her, hence her feeling groggy and out of touch, and like time wasn't real. These are all things that she said. But if it's in her lemonade, how would she
And it's
know?
also to make her more docile, I would think.
Yes.
Or
Right.
The first word that came to my mind was subservient.
Yeah, possibly. Possibly.
I keep seeing this sentence repeated across some of the comments in social media, which is there's nothing more dangerous than a man who wants a new life.
Absolutely.
We've seen this before, and Chris Watts and many, many others, that for some reason they feel the need for this fresh start. And
Rather than divorce. And
And
some
then
people
divorce.
are saying because look, again, I'm not saying Patrick did it, but the conversation about let's look at the advantages of having 3 children who got unalived. There's no maintenance, there's no divorce payout, the GoFundMe, it was just such a slam dunk, some are saying. And that's what's arisen my suspicion or my concern. Because like I said, I need it to be straightforward, and it's not.
How
If
fast
you
did he
are a
move on, Harley
narcissist-
Quinn? Well, from what we understand, and this is coming from people in their running club, they were both marathon runners, the new wife and Patrick, that they had been, it was common knowledge that they had been canoodling for quite about a year before the Schmurders. But from what I understand, and I will look it up again because I've talked so much today, I don't want to lie to y'all, but from what I understand, 4 months later, they were partially cohabitating with one another.
Well, there was a photo that people have tracked from 2022.
Then so the running partner was right that an affair isn't a motive in this case. Tell that to Shanann.
No new
But I
baby,
also
right?
say-
No confirmation of them having a new baby, correct?
No, I think they're on their second one. I think she's about to have her
second.
second baby.
Yeah.
Second
expecting her
baby.
second.
Okay, because I
You're
couldn't
not-
I mean, if
find
you want to
that.
talk about a reason, a motivation to unalive rather than just divorce her, I mentioned it earlier. Everybody loved her. His family
Yeah.
loved her.
Yeah.
Everybody loved her. Imagine how he would look, particularly if he was a narcissist or a malignant narcissist, or if his own ego was going to take a massive pounding, he was going to abandon his family for a love affair. That to me would be a motivation to do it this way.
To a narcissist, a
but
divorce
it-
looks like a failure. And I can
Yeah.
tell you from my experience of divorcing a narcissist, I had to send out divorce documents 11 times because he would not sign them. In the end, I took a ward of the court and a policeman, found him in his local pub. It's called the Ferry Inn in Shoreham by Sea. Always ingrained in my mind. And literally in front of a whole pub full of people, I said, "You're living with another woman. She's expecting your baby. I need you to, for God's sake, sign these divorce documents." And it was only because literally everybody in that pub went quiet and they all turned round like their heads were on a corkscrew and were staring at him that I actually got those divorce papers signed.
There you go.
It's
And
control, and because they
Yes.
think they failed because it's
Yes.
a divorce.
before I
Katie, by-
forget,
Kate-
I also want to say that it came out in these documents that, and I don't think these are the prosecution documents, but another statement that he was, and he said this on the stand, he was continuing to do his golfing. He was going out with his
he's
brunches.
spraying.
Brunches.
He was
His
refusing
brunches. How
help
many
from the
men
in-laws.
do you know that go for brunches? He was seeing her.
Yeah.
Yeah, he refused
Katie,
help from
what-
the in-laws. The in-laws offered to take the kids for a week. He refused. Not her. He refused. He fired the nanny because she was a stay-at-home mother.
And she
And
was
she
just
didn't
getting
leave.
worn out. She'd given up her job. I think she was also quite isolated. And I think what really breaks my heart, yes, I know she unalived them, but in the morning, was it that she took them to the beach? And that's why the doctors confirmed that everything seemed to be normal. That's another red flag. By the way, Katie, my daughter was born in Brighton and my ex was, yeah, I know. So I know Shoreham very well.
Hey, he wasn't called David, was he?
No. This is back, but mine was called Rob, but he's currently walking around in
Mine was
Switzerland.
Bob.
Oh,
Can
no,
I
something else. What was I going to
can I
add?
ask-
Hold
Can I just share one more thing? Did you see the connection between who's that lady who she's white, but she was a doctor? Was she a doctor? She had a ruffle around her neck and she's being very a hostile witness. Internet has gone and done their thing and found that her Facebook, she's connected to a lot of the Clancys,
Oh, really?
including his wife. Do you know who I'm talking about? The woman who was
Not
really
sure.
po-faced.
There's also
lady-
a police chief called Matthew Clancy.
Right. I think that's the brother-in-law. I haven't confirmed that yet, but from what I understand, the police chief
Well,
was
he
his
wouldn't have the same
brother-in-law.
surname, would he, if he was Chris's brother-in-law?
Or brother. I don't know. I don't want to
I think
lie.
it's his
So I
brother
don't
or
want to
uncle.
they'll clip it and make a whole video about me. So
Yeah.
I don't want to lie. So I'll figure it out though. We'll figure it out. If not, Solon's really good at that stuff. You can help us figure that out, Solon. You're good
Yeah.
at that.
Yes, Laurie.
Can I,
Yes,
can
Charlotte's
I-
his friend.
Y'all
So
talk
can I
about
ask
I've also
a
heard
question?
that
Can't hear y'all. There's too many
evidence
talking.
somewhere. I've heard there's evidence somewhere that he was looking at property in New York a year
Yeah.
prior to this
We were
event.
covering that.
But
Yeah.
I don't know if that's confirmed.
Yeah. Well, it wouldn't surprise me given that the running partner did confirm that they all knew
There are
that they were.
so many threads that are just being unraveled.
Yeah.
But
Can I
goes back
ask
to
you,
what has
can
he
I
done
ask you
with
Hold
that
on, one at a time.
£1
Yasmin,
million?
hold on one second.
Sorry.
What were you saying? Hold on. She was.
so can I ask you a question, if possible? So in
Yes.
the UK, it's become very open, and we're talking more and more about
You're
postpartum
babe, you're
depression.
real muffled. I'm having a hard time hearing you. Can you get closer to your phone? I want to be able to hear your question.
Can you hear me now?
Yes.
Yes.
Yes. So in the UK, it's becoming more common for postpartum depression to be
I
discussed
can't
about.
hear her.
It's
Hold on. Can
becoming.
y'all hear her? I'm having a really
No,
hard
I'm
time.
struggling.
We're all
wait,
having a
that
hard
one
time
minute.
understanding you, hon. Are you in the wind?
About in the UK and postpartum depression, I think.
Is that better?
Yes.
Yes.
So
Yes.
much.
Brilliant.
Thank
So,
you.
in the UK, we basically this discussion around postpartum depression has become much more known, and we're basically being told, look, if you have these symptoms, you need to come to the doctor because you obviously need
Right.
some help. I'm just wondering what it's like in America. Is it very much? Is it like? Do you discuss it, or how is it?
Honestly, I feel like it's becoming more discussable, but I think it's been so taboo with us for so long that our friend Steitner said, people are worried that they're going to lose their children, that they're going to be looked down upon, that, it's just, like Solon, what are your thoughts on this? So we don't hear from you too much tonight. What do you
I
think?
mean, I would say it has came a long way, but there's still this stigma that's never going to go away. So most women are not going to share that.
Right. Yeah. It's just so it's almost
Especially
like
someone in her profession. You know what I'm saying? Like
Yeah.
you don't want to risk your entire life just to say you have postpartum depression.
She has a nursing license, she might have
Yes.
been afraid. But the thing about Lindsay and what I've read through all this is she was so proactive about getting herself help and doing all the steps. She did not come across to me when I'm looking at her medical records and, which I'm used to doing with other patients and stuff, that somebody that was fighting the system, like she was doing all the things and just reaching out for help, willing to do anything, went to the therapist, took her medications, was journaling. She was doing all the things. And so, but
yeah,
if
we usually don't have that aspect in these kinds of
Right.
cases.
Yeah.
You don't. And so that shows me that she wanted to get better, that she just didn't want to spiral. She was, communicating her thoughts and her needs with her husband, her doctors. So again, that doesn't strike me as somebody who out of nowhere is just going to decide to unalive her children. She was also very concerned about their health. She was always on top of their doctor's appointments, making sure that she was doing, again, all the
Everybody
things.
said she was a fantastic, caring mum.
Exactly. So for this to be...
No, he didn't marry her, Mrs. B42. He got with her, shacked up with her in Manhattan 4
They
months.
just got married about
They
5
just
months
got
ago.
married literally just before the trial started.
It's the husband's reaction of when they're discussing the children that really makes me think that it's something not right, especially when your children have been murdered. It makes me think you're not having the before people say to me, "Oh, people grieve differently." I know that, but when your children have been taken from you so brutally, I'd be in tears. I'd be screaming. I'd be like,
Right.
and I have lost a child. I have lost a child, and there's times where I can't even talk about him without crying. So the
agree.
fact
I will
that
say,
Hold on, let
I
her
will
finish.
say-
Hold on, let her finish. Oh, go. Sorry.
I will say that's what happened to Lindy Chamberlain in Australia. She was very mute in her grief, and that's why, public sort of trial convicted her and said she wasn't sad enough, but she was proven innocent. They found the remains of the baby in an old dingo den, and so I don't think we can rely on his reaction.
Yeah, that's true. I mean, look at, Susan Smith, who put her boys in a lake in the back of her car. She was on the news sobbing, just snotty tears all over every day, knowing that she just put her 2 kids in their car seats and rolled them into a lake. So I get that. And, grief is different. Again, I've lost a child. I know sometimes you are going through the motions, and it's hard to, and I'm not judging him on the way he's grieving at all. I mean, I would never, especially losing a child myself. It's not my place. But it's all the other things. It's just every other thing that he's done.
And also,
this
I think he
timeline.
gives off the air that he's angry that he's being questioned about it all. Now, what possible reason could you have for being angry about being questioned?
Yeah,
You
he
would want
does.
to get to the bottom of it. You would want the truth to be known. You would be, I
I
don't
think
know.
he knows that all the truths are coming out. I really do. I think he sees that this is not going
He's
to
a
end
wrong
well.
un.
He gives off a very much Chris Watts kind of like, I
Yeah.
don't know, he just comes across as that kind of person.
Yeah, I
What
agree.
what astonishes me is the, in a way, audacity that even his friends' families of both the new wife, they could have just waited. Maybe that's a quite how can I say it, quite cunning or whatever, but
Mhm.
the fact that they rushed and they settled, is there no God, that sounds so old-fashioned. Is there no bloody decency left in the world anymore? Which
Yeah.
is, let's just wait for this trial to get married when I've got 3 children. I'm a mom. I just couldn't do it.
No,
I think he got
couldn't.
cocky, to be honest with you. I think he's comfortable,
It's his
and he's
character.
sold this story to
I
the
think
world.
he's been waiting for a long time for this new life with this new woman, and I just think
Well,
He
we all
checked out
fell
years
for it.
ago, maybe.
he couldn't hold himself back anymore. Now, I did find quite an interesting video about Patrick and Lancey, and they go Patrick and Lindsay. They're checking in somewhere because they were on a day out. You would honestly think that Patrick was with a different family because he's standing apart from them. It was all Lindsay interacting with the children. You would
So
honestly think that he was not part of that family. He was even standing apart from them.
I keep hearing something about the internet not working and he couldn't make a phone
You
phone
can
call.
still make a phone call from your network.
Yes. Apple allows
Sorry.
you. He's
Yeah.
got an iPhone. It allows you to call emergency services without access.
Exactly.
to
Yeah, he
Wi-Fi.
was completely
Well, it still
checked
had
out.
service. It just wasn't on Wi-Fi. So my thing yesterday was like, I was like, if we can show that her cell phone left the home unconnected from the home Wi-Fi, we can show that he took the phone to CVS and made the call himself. But then it comes out that he says the Wi-Fi was down. How fucking convenient is
Yeah.
that? You know?
And the nanny cams weren't working, and the
And the nanny
doorbell
cams.
camera wasn't working, and this
And-
wasn't working,
And so
that
the
wasn't working.
theory that I've heard is what people are proposing is that he, sorry to say, did away with her first. Okay.
That's what I think.
Because obviously she would have been the adult.
Right.
And then
Exactly.
he went and took her Apple Watch to show the call, but then
Yeah.
it would show in the mastheads. or wouldn't
So
it?
you all can't accept the fact that a woman killed her children? Is that
Oh, we
really
can
the...
accept
Oh,
that.
I
Is
can
that
definitely
really
Oh,
accept
come on.
that.
you, as a
Yeah.
man,
All
dare
right.
to come up here and
Okay, so
Just
I-
put it down to that?
spitballing.
Really? Please.
How about
No.
being
So
polite?
how it looks to me, it's like she killed her 3 children, but a lot of people are saying the father did it. So, but
Because
I
there's
don't know what.
conflicting facts. There's conflicting
but-
Things are not always
information.
as they
But
appear.
what are the
There's
reasons to think
conflicting
that the father did
information.
Let
it?
me
That's
ask him
why.
a question real quick. Have you watched the trial, and have you gone over any of the documents or any of the evidence before we move on in a conversation with you? Are you educated on this case?
I have watched the part of her
That part.
trial.
That's a no,
the
then.
whole thing. There's a whole bunch to it, because I don't want to go back and forth with somebody who doesn't know the case, because it's not going to do you or I any
I've
good.
watched
Have you-
9 days of
Okay,
trial
I'll-
from
No,
Australia,
I mean the
start to
gentleman.
finish.
I will
Let-
look
let
into
him
it and then
answer.
come back to you.
Yeah, do that.
You
Yeah,
really need to
'cause I'd
educate
like your
yourself
opinion.
on the topic before you come
Okay,
up
thank
here.
you.
Mr.
Thank you.
No-no
Have a nice
Very
day.
welcome. But we would love
So-
to have you back once you do watch it. I'd love to hear your opinion. This is an open panel, but it's not going to do us any good.
Okay,
You know,
thank
to
you.
talk
I will look
to-
into it and then come back to you.
I would like that. Thank you. Bye.
The
Okay,
magnanimity.
so that's
So-
just what we need to do.
Oh God, this baby. So, one question. So, does anyone actually have an idea? So, he found her in the garden, obviously after going into the house, coming out of the house, and going around and finding her beneath the window. How much time did it take for him to call the ambulance between like finding her?
So
9 minutes.
From the time he called her the last time and the time he called the ambulance, it was 4 minutes from when he got to the house. So from
4
what I
minutes.
can understand.
I would be calling 911 as I ran up to Lindsay.
And he also, in the statement, he parked right next to her car, and
Yes.
then he said he had to look out the window to see if she was
To
home.
see if it was there, yeah.
Right.
This is what's making us second
Yeah.
guess him.
There's a lot that he's
Yeah,
said,
there
and
is.
that's why if he'll lie about one thing, the truth is always the truth. But if
See,
you lie,
I
you
th-
have to continue to lie.
See, I'm going to say, I reckon what he's done, and this is the impression I'm getting, is she's been so out of it from the medications. She has no idea what's happened. And
Yeah.
he's went to her and he said, look, this is what happened. You've done this. And
He's
planted
planted
that
the
thought in-
memories in her.
Hold on,
He's
let her
planted
finish.
that information.
planted that information in her head, and she's thinking it's real. She has no clue what's going on. She's
Right.
off these medications.
And everybody's telling her this, right? Everybody's telling her that she's murdered her family. So you're right.
I
What
have a
else was she
question
supposed to say?
regarding this whole case.
Yes, Opal. Hi, welcome up.
So it takes, from my own research that I've done on temperature changes in the body and stuff, it takes longer than 20 minutes for your
Oh, yeah.
in ice cold water
Right.
Yes.
for your body temperature just to drop to 90.
Right.
Yeah.
That's
How
true.
is she at 82 degrees Fahrenheit?
And that's at the ER. Opal, you've been here most of the evening. She would have probably had to have been around 78, 79 on the time of arrival because they spent 9 to 11 minutes warming her, which you have to do slowly. So she was probably around 78, 79 when the EMTs got to the house. That's a
I
great
mean,
question. And tell
Sorry,
us
can I
how.
just, Adam, why don't you
So
jump
she
up?
was
Hold on, let
outside
her finish.
longer
Hold
than
on, let her finish.
the
ahead.
timeline than what he says.
Right. That's exactly what we're saying here is that there's no possible way
Yes,
that her core temperature got to that in the 20 minutes. Let's say the whole 40 something minutes that he was gone. It still isn't possible. It didn't happen. It just simply did not happen that way. And I think that that's what the ladies here are saying. There was an incident that led up to this. She had been in
And
that.
also looking
barn
at
a long
the
time.
photos of how the stuff was placed on the nightstand,
Mhm.
if somebody's in that mindset, I guess you would say, they're not going to place the weapon they used so neatly on a bedside table.
Right.
It's just not going to happen.
I know.
All the lids back on the containers, all the pestle back
Yes.
into the drawer, all
Yeah.
closing the drawer. None of those things fit with psychosis.
None.
And there was something else I learnt about. Is it the baby? Which baby was it that was resuscitated?
The 8-month-old.
10-minute rule? Do you know about the 10-minute rule? Have
No,
you come
tell
across
us.
that yet? Oh, I think I might have to come back and tell you. Is somebody saying that in order for the heart to stop, something about 10 minutes, and that therefore, I'll have to come back. I read
I don't
it.
think the
but
baby ever passed away. I think it was strangled and it was hanging on to life. But I
yeah.
think it was just, he wasn't gone yet, obviously. And they found a faint heartbeat. They did what they did. They couldn't keep him. He was brain dead upon arrival at the
I'll come
hospital.
back.
They had
I'll
him
go
on
and
life
do my-
support.
I'm
So,
sorry, but I'll
also,
do my research properly
One
on
at a
that. But what they were trying to say is that 10-minute proves that Patrick was in the house. So let me go away and come back and be more clear on that.
46
And
minutes.
then
Well,
my
you
question
can,
about
but
the
it's under
DNA and everything. What is
Hold
the
on, Opal.
bands?
Opal, say that again. Hold on. Pause, everybody. Let's all try to talk one at a time because we can't. The people in the comments, nobody can hear. So I don't want to make sure all
I'm
of you
gonna
are
have to
heard.
fire up because y'all just yep.
My question
Opal?
is about the bands with the DNA on them. That makes no sense to me.
Right. it doesn't make sense to a lot of us that from what I understand, it was only on one band. I will verify that. So when we come on tomorrow, I don't want to lie to y'all, but I believe that her DNA was only found on one band, which when they come wrapped, I looked them up, they're wrapped, like in a ball, and they have little cardboard over it. So if she would have picked up that box to buy it or picked it up at all, I could see how her DNA would only be on one because the other ones are wrapped up inside the outer one. Does that make sense? I think that might be how it worked, but we don't know.
And then I had another question was, did they do a toxicology report on the kids?
Yes, I do believe they did. I think I read, and again, I'll verify this, that they found something in the 10-month-olds. I attributed that to her breastfeeding, but they're saying that she had stopped breastfeeding. So I'm going to dive a little bit deeper into that tonight. That's why I've been writing down all my questions so I can make sure we have answers tomorrow, but ones that are researched and just not my opinion.
Can I just quickly say about the 10-minute thing? Yeah, that would normally apply, but however, I know anecdotal evidence. There was a little girl who died on a ferry. I think it was the Zebra ferry incident, which happened in the 80s.
Mm-hmm.
She was pulled out of the water after about 3.5, 4 hours, and they managed to resuscitate her. But because she was in the water and the water was very cold, she more or less went into
I've heard of that before, that happening before with people that are submerged in water.
It has to be very, very specific.
That is cold water specific, though. That is actually the way the body is cooled. So it's very different to actually unaliving out in the air and the elements.
Yes. And you got to remember, at 78, 79 degrees, your cell structure is breaking down. Your brain is starting to die. It's not normal to be alive with your inner core temp that low. So all kinds of things are happening inside the body. It's just not normal, and it just doesn't happen that quickly.
Also, the fact that Patrick is trying to say that she told him where the children were when the EMT, when they came, she was unconscious.
Right.
So basically, we've got his word against hers, kind of thing.
She was just guttural sounds were coming out, which is her body reacting to the pain and what she was going through. And
So
I'm
no
going
one
to show you
actually
guys,
heard
hold on, I
her.
think I got the Ziploc here where I showed everybody yesterday. Hold on, I'm going to show you how much blood they pulled out of her lungs. Hold on. Let me show you.
So no one actually heard her speak.
No, apart from miraculously Patrick.
Right.
Oh, has everyone else heard about the theory that he used the window on her neck?
I have heard about that, but I think there'd be, I don't know, it just seems a bit, maybe, I don't know. There's
Could
so
you-
many things about
Could
this
you
that just
expand
make
on that? I don't know. I haven't heard that one. Could you tell
All
me
right.
more
So
about it
y'all
today?
have seen a catheter, right? When you're in the hospital and somebody will have a catheter, it's where your urine goes. And this is what approximately 300 cc's of blood that pulled out of her lungs. This is a gallon. Ziploc bag. This is what they pulled out of her lungs alone from the puncture wounds from the 5 broken ribs. So she also had brain and spinal fluid coming out her nose when they found her. She had a crushed thyroid, a slit throat, slit wrist, major damage to her body, and her core temperature, and I'll give it the 82, okay, because that's what she was at the hospital. She wasn't having a conversation with Patrick. And if Patrick will lie about that. He'll lie about anything.
I've been hearing theories on TikTok about the window being used to basically her head.
like a guillotine almost.
There wasn't any marks from what I understand. Let me dump this out.
I would think that would leave more of a mark.
Sorry, hold on. I had to dump that out. Say your question again, sweetie. What was your question again?
I think it was Sadia, wasn't it?
Yeah, it was. So I think this is more conspiracy on TikTok, to be quite honest, but a lot of people have been saying about the window and how that could have been used to make the marks on the neck.
Right. Yeah, I don't think that's what happened. From what I understand, there wasn't any marks. There was just, the slash that she had, and then the crushed thyroid, which I think a lot of us have agreed was from one of these, like, how you put your arm around somebody. I think he was trying to snap her neck and then throw her out the window so it would look like a broken neck from the fall. And he didn't do it. He crushed her thyroid instead. Probably still
Well, how do you
responding
think
to
she
it.
fell, Jen? Like, how do you think she landed?
Well, so there was blood on the side of the house, Solon, and so what I think he did was he had her by her ankles and was, you know, putting her out the window, which is how the blood off her wrist. Shut up. Sorry, the dog will bark at a molecule in space and it will never stop. So I'm sorry. Yeah, I think he hung her out the window and dropped her on her head because the break that she had in her spine was not like an impact break. It was from like compact. So it shows us that she landed directly on the top of her head, and that's how she got the spinal injury, and hence the fluids coming out of her nose and everything like that. And she had nothing showing that she instinctually, no matter what, if you're falling, your body, whether you try to or not, you're not going to fall like this. Your body is going to try to brace for impact. And there was nothing on her hands, no fractures in her wrists, nothing. She just was, I think she was hung upside down and dropped out, and he was hoping that it would break her neck. And instead
Slid down the wall a little bit as well.
I'd suggest she was flopped out the window. She smacked against the side of the house. He's dropped her on her head. And I think she was unconscious. I think she was unconscious for all of it.
Let me show you the window. This is what we estimated. Hold on, I'm going to show you how not far she fell from. Let me show you this window right here. Shit, you can't see it. So there's a window right above here.
Right? 12 feet.
And so that's about 15
Gemini
feet.
then.
Not very far. But if you're hanging upside down from right there at that window and you drop 15 feet onto the top of your head.
Against the wall a bit. And
Yeah. You're going to hit the wall. And that's how, because if you jump out, right, you're going to land out here, guys. But if he's got her dangling,
jump away
he's
from the
going to
wall.
hit this. You know what I mean? And that's what I think happened. 15 feet is not far. I could jump out that window right now. I'm not going to, but I could, and I would live. I wouldn't be hurt or anything, but I would brace and, land on my feet. But if you drop 15 feet from, on the top of your head, it's going to do some damage. And that's what happened.
I think the other thing to consider is the fact that she would have been a dead weight in his arms. So if she was unconscious, him trying to slug her out the window is why we've got these flop marks on the side of our house. Because he's lifting her portion at a time.
Right. Hold on, let me get Solon's response. I didn't hear what she
I
said.
just said there ain't no way I'm fucking jumping 15 feet. Like, I will break.
It's just not that far.
Like, you're gonna break
It's not
something.
that far. 15 feet is not that far. If you're
I think you would break
expecting it and
something. Maybe
I mean,
a
I've
toe,
jumped more
something.
than 15 feet and tucked and rolled, and it's obviously I'm not suggesting that that's what Lindsay did.
Yeah, she
Could
didn't
have
brace
dove
at all.
out though, right? She could have dove out herself, right?
She could have, but then
Double-
that
double
was
advocate.
the blood
But then
against the
it
wall.
would have physics. If you are propelling yourself out of a window, you would jump outwards. She
Away.
would be further away.
Yeah, she would be away from the house, Solon, where if she was, hung out the window and dropped on her head, because she's passed out, she's not going to brace for that impact, which is, I think, what, he was trying to do was break her neck and kill her, or give her a massive brain injury, which he did because she had a TBI. Then we wouldn't see the blood marks on the side of the house either. So, it's just like kind of one thing after another that makes this make sense, but none of this.
Well, I need you to send me the panel, Lindsay's panel. I need to know what was in her system and at what
Can I
levels.
send
Did it
pictures
show the
through
micrograms,
Also, too,
like the levels?
I think I
medication
can look them up. I'll
or
see if the
just the
full
medication?
panel's on there.
Yeah, you don't have to do it right now, Jen.
No,
If you
no,
wanna
I'll do it,
find
it's fine.
and send it over. That's fine.
Message me your email, and that way I can send you like what I've got
I have
downloaded
some
if you want.
questions
Yeah, I
from what
will.
I've seen just from the trial of her body language.
Mhm.
Did anyone notice when he was in the courtroom, she was hiding her face behind her hair? And then as soon as he was dismissed from the courtroom, she pulled her hair back away from her face.
Oh, really? No, I didn't even notice, but I'll look.
I noticed that, and to me that she's hiding, she's scared. I think there's a lot of
Body
domestic
tells you
abuse
until your
going on
brain
with
does.
those two.
There might have been. I mean, she did take him off as her POA. The first day that she opened her eyes and she took him off as her medical healthcare proxy. So that tells me something as well. Why would you take your husband off if he was being supportive and doing everything in your best interest? Why would that be one of the first things you do? I mean, I wouldn't do it with my husband. I would, I wouldn't wake up and go, get that motherfucker off my healthcare stuff. That's just not something I would do. So it makes me wonder, what was she thinking? Why did she feel like she needed to do that?
I guess my next question too is, why wouldn't she tell her attorney if there was domestic abuse going on?
I don't know if she has. We don't know. I think a lot of this is going to come out this week, that we're going to find out a lot more than we have. I think that's what he was setting up this week, dropping all these breadcrumbs to us so that, I think a lot of information is going to come out this week.
So my understanding from this court case, it isn't to judge whether she's guilty or not. It's to judge whether she was, what's the word for it? She wasn't fully
culpable.
Yes. But I feel like from the lawyer, the way that the lawyer's presenting it, he's more presenting it to show that there's a lot of things that are not adding up. And it's almost like he's trying to get justice for her.
I feel like this is what I feel. I feel like he's setting it up to show us that she didn't do it, but to show us exactly who did. That's what I think is about to happen.
Necessarily covering for him, Glenna. I think he's planted something in her, and she is so used to being the one that goes along with his suggestions. And let's face it, at that time, they were still married. If I was completely out of it and I woke up in a hospital and somebody said, well, your husband said you did this. I mean, brainwashing is very, very real.
And the law thought she did it. I mean, it was slam dunk. They didn't do this big investigation, and they did interviews, so we don't get that twisted around. They did interview everybody as they do, but there wasn't an investigation. It was very cut and dry. She did it, and that's it.
And did you notice, going back to the GoFundMe, he actually asked for the public to forgive her.
Really?
That he had forgiven her.
Not just he asked in his GoFundMe message update, he said he's asking the world, or, please, I forgive Lindsay. I ask all of you. Which I found very strange. It's in the body.
Me too. I thought that was very strange.
And I felt that was a mark of I don't know, could it be a mark of a guilty man who's suddenly found that he's gotten away with everything? Is it the perfect murder?
I thought maybe it was religiously motivated,
Religiously? I don't think they were part of a big, were they?
Something about Catholic in his background with Patrick.
I don't know. I'll look that up.
Also, what's this about the voice telling her to do it?
Yeah. She was hearing voices.
Big thing in religious things, so I thought maybe that's why Patrick said it.
They were Catholic. She was saying that she was hearing a man's voice. I think it was him, to be honest with you. I think that it was him when she was highly medicated.
He wasn't
saying
investigated
these
properly, Hiddy.
things.
Hiddy's saying he was investigated. I'm saying he was not investigated.
No, he was not. There was no investigation.
Or he was.
If there was, please send it.
Extremely cursory way, because the police thought they had their man.
There was no reason, as far as they were concerned, to do an investigation other than the simple interviews. And again, if you have that, we're here to learn and see all the evidence. So I would like to see it if you'll share it with me. I have not been able to find anything. Anything that I've shared this week is literally from the prosecution's information. So the only opinion that we've given on this panel is our personal opinions about timeline and things like that. But everything else is in black and white. So if you have something in black and white that you can show me, I definitely like to see it, because it doesn't do us any good just sit here and say a bunch of shit that's not true, right? We want to figure
tell you what, though, if somebody tells you something often enough, and I'm going to do another little anecdotal thing here, okay? I split up with my husband when I was pregnant with our second child, and because he was messing about with other women, he kind of was trying to plant the seed that I was as well. And indeed, actually said that our second child wasn't even his. And I can remember I went in, I had to have her by C-section a month early because she was breech with her legs extended. So, as anybody here who knows anything about obstetrics will know, that's dangerous for her and it's dangerous for me. So, I had her a month early. My mum was at the delivery with me, and I can remember being wheeled back on the ward and hearing all these awful things that man had said about me, and looking at my beautiful newborn child. And I'll tell you what, she was pretty because she was a C-section baby, so she didn't have the squished head and looking at her and thinking, well, maybe he's right, maybe she isn't his. And I can tell you, hand on heart, categorically, I had never so much as looked at the man, but I still had this awful intrusive thought, what if he's right?
Isn't that something how that works? They just, people get in your head, and she was a very sweet lady.
They do, and you're very, very vulnerable when you're pregnant and when you've just had a baby. Very vulnerable.
I don't even know if she was as sick as she thought she was. I'm wondering if these drugs and he was making her sick.
And also, she was just could be just very stressed, just needed that little bit of support. But then he saw that as a gaping crack, which he then widened potentially. Would you mind if I've just found Patrick's statement about Lindsay. Can I read that out? Is anyone interested?
Yeah.
So this is his update on his GoFundMe. And he's put here, I'm not going to read, it's quite long, but I'm just going to read the excerpt.
That doesn't surprise me.
Lindsay, he says, I want to share some thoughts about Lindsay. She's recently been portrayed largely... Sorry, excuse me. Honestly, it's a speech and a half. Jesus. He's written here, I want to share some thoughts about Lindsay. She's recently been portrayed largely by people who have never met her and never knew who the real Lindsay was. Our marriage was wonderful and diametrically grew stronger as her condition rapidly worsened. I took as much pride in being her husband as I did in being a father and felt persistently lucky to have her in my life. I still remember the very moment I first laid eyes on her and can recall how overcome I was with the kind of love at first sight you only see in movies.
Anybody else cringing?
It really didn't take long before I was certain I wanted to marry her. We said, I love you to each other multiple times daily, as if it were a reflex. We habitually started every morning with a passionate hug, yielding a sigh of relief, like we had each received the perfect medicine. If too much time passed without a hug, she'd look at me and ask, did you forget? We mutually understood the reality that people can have bad days, but we stuck to the rule that when one of us got lost, the other was always there to bring them home, always. She loved being a nurse, but nothing matched her intense love for our kids and dedication to being a mother. It was all she ever wanted. Her passion taught me how to be a better father. I want to ask all of you that you find it deep within yourselves to forgive Lindsay as I have. The real Lindsay was generously loving and caring towards everyone. Me, our kids, family, friends, and her patients. The very fibers of her soul are loving. All I wish for her now is that she can somehow find peace. I'm not going to carry on, but
I wonder if he was thinking that when he was in New York then.
Yeah.
If that was his thoughts when he was in New York.
While he was getting another woman,
Yeah, and sticking by each other's side, but yet he was most likely having an affair and divorced her in the worst time of her life, and didn't speak to her until 6 months after the incident on her birthday, and that was at her parents' urging that he did so. And here on the GoFundMe, the assistance is especially needed because Pat will be unable to work for the foreseeable future as he weathers the painful, life-altering tragedy. And it was supposed to go to medical bills and the funeral, yet Lindsay's parents are the ones who are paying for all this. He didn't pay for this.
But what's interesting is he's saying, oh, I love Lindsay, forgive her, but he's not mentioning, oh, I also want to use that money to pay the legal fund.
And buy a flat in Manhattan. So we went from this very modest house in the burbs to a flat in a mid-level high-rise in Manhattan. I mean, it's obtuse. It's disgusting that the display of what he's done with this money is gross, and that he even took $1.1 million.
Did these children have life insurance?
I don't know. I couldn't answer that. I'd have to look that up. But I will. I definitely will.
I mean, his new wife apparently is from Old Money, and do you remember years ago there was a Schmeck's cult, and it had that girl. She was an actress. She was in.
Yeah, I know who you're talking
Oh,
about.
the Superman thing. I can't
Yeah.
remember what it's called. And it was all busted wide open. She's in prison now, and apparently the new wife's dad is something high up in that.
Oh wow. Oh, that's weird. But not surprising at this point with everything that, keeps coming out. There's quite a few questions in here that I couldn't answer tonight that I have written down so that maybe I can find, true answers for everybody tomorrow. And I definitely, the trial starts again
That's it,
tomorrow.
Seagram.
So tomorrow afternoon, I would really like to continue discussing it. I have to get off for the night though, because I have to do some stuff with my son. But I mean, I thank you guys because we've been doing this and I never stay on TikTok this long. So between this morning and tonight and this whole week, I really, really appreciate all of you coming up and giving your input. And I hope you come back tomorrow evening and let's see what Monday brings. And Solon, send me your email and I'll send you over what I have. And if you find anything, send it to me. So.
Yeah, I will. Thanks for having me.
Very much
Jen.
looking
for coming
forward to
up.
the
Thank
defense.
all of you ladies and nurses
for
that
having
shared
me.
your opinion
Take
tonight.
care,
Thank
all
you.
of you. And if you've got
Thank
little
you,
ones,
everybody.
love them.
Tomorrow night, 6:00. Let's reconvene and see what we find out tomorrow.
Okay. Good night, everyone.
All right. Good
Bye-bye.
night, everybody.
Thank you.
Mwah. Thank you.